10:02 a.m. Welcome. A fabulous Friday. It looks like there's Senator Matthews is joining us via the Zoom accounts. We have over 34 people that want to testify and talk about what's in front of you. I think for our conversations, members, Mr. Raymond is here, and he's going to go through. Here's how it's laid out. Unless you want to spend the next 10 hours going through the language on the delete all and the spreadsheet. Here's how it's really laid out, though. That was supposed to be funny, you guys, but it's not. So the spreadsheet really drives the language. So everything is focused on the spreadsheet. If you're seeing, as Mr. Raymond is going through the spreadsheet and it's not matched up into the big paper products, please send your comments to, I don't know, maybe Liam, I guess, on that one. Yes, he's laughing. That's funny. But really, these guys, you need to know, folks, this is not an easy task. And it's to match up language changes, to correspond that with someplace else within a statutory place, to then, oh, by the way, you better count every dime that's sitting out there, and Mr. Raymond has really done an amazing job of putting this budget sheet together. I want to also thank Mr. Albright, because for Mr. Raymond and I, this is the first time we're doing this, so it better be some grace there. So I want to thank Mr. Albright for his work and many years of doing that, and Mr. Monahan, to match up what Liam Monahan and Kyle Raymond are trying to do, to match that up is a huge task. And so, folks, if you don't see something that's in there, I'm not going to personalize it, but please, let us know when it's there. But I don't think you're going to see that. I think it's pretty well done. And so, what Mr. Raymond's going to do is kind of go through just our Senate File 2934, the spreadsheet right in there, and then there's 34 people that are going to be testifying, and I believe we're at 33 minutes. Is that what you're? 3 minutes. 3 minutes. 3 minutes each on the 34, and so I want to make sure that people stay to that 3 minutes. Is that fair? All right. So with that, members, Mr. Raymond.
Thank you, Mr. Chair. Good morning. Good morning, members of the committee. I'm Kyle Raymond, fiscal analyst to the committee. So as the chair mentioned, I'll be walking through the spreadsheet today for Senate File 2934. So my comments related to the bill are going to reflect what is in the A1 amendment, the delete everything amendment. So just to kind of orient members, the document that I'm using is the publicly available documents that should be in the members' packet. In the bottom right-hand corner, there's a timestamp from yesterday at 3:12 p.m. So when I'm referencing pages and line numbers, it's that document that I'm referencing. Just to provide an overview of the spreadsheet itself. So on the left-hand side, there's descriptive information about the spreadsheet.
I'm not sure that's what they have. They just handed me 1216.
That's the one, I think. The one he has up there.
Senator Edke.
Okay. You referenced a timestamp on yours of 3-something. What we've got is 1216. Is there a difference in them?
So there is a difference. There was a note added which would affect the lines. I think everything would be off by about a line or two. So what's displayed on the screen is what I'm referencing, and we can have the updated
Raymond,
spreadsheet printed.
Let's do this. Mr. Raymond, here's what we're going to do. Senator Edke, so what we're going to do is we're going to take a break. We're going to get the right copies so everybody's in the same line. So, all right, so we are in, I guess, recess. Now that you have, it's one line off, so it's up there and it's online is correct. I think there's we should be good to go, Mr. Raymond, so go ahead, thank you.
Right. Thank you, Mr. Chair. Members, again, Kyle Raymond, fiscal analyst to the committee. So now we'll just provide a brief overview of the document. So the first page is largely summary information. On the left-hand set of columns provides descriptive information about either the totals or proposals. The center set of columns is the governor's revised budget, and the right-hand set of columns are Senate File 2934, the DE, which is the A1 amendment. So one thing I wanted to note is in that right-hand set of columns, if there is not an amount included for the proposal, then that means the bill did not include that governor's proposal. So now moving to the spreadsheet, the all agencies total is the first set of rows. So if I could direct your attention to line 5, that includes the target, the 1.3 billion target in fiscal year, or excuse me, for fiscal years 23, 24, and 25. So that amount is the cumulative total for the general fund contained on line 7. And then you can also see on line 7 in the right-hand column the $1.55 billion total for the general fund. Below line 7, you see the all funds or the all agencies total among the different funds. So now moving to line 18, so there is a provision in the bill that amends Chapter 16A, which governs how the forecast is constructed. So this provision would move funding for the Long-Term Care Access Fund to just before the budget reserve when a positive unrestricted budgetary general fund balance exists at the close of a biennium. So this amount, as indicated in the note, there's no the future value is unknown, so there's not an amount included for that provision. So now moving to lines 35 through 41, this shows the change to medical assistance broken up by eligible category that is contained in the bill. Moving to lines 43 through 88, this includes each of the agencies, the total broken down by fund for each agency included in the bill. So now moving to, starting on line 108 on page 1 is, I'll get into the specific proposals, starting with the Department of Human Services. On line 110, the governor's proposal related to nursing facility case mix classification modifications is included in the bill, and the fiscal year total for the 24-25 biennium is $117,000, and for fiscal year 26-27 is $70,000. So moving now to page 2, line 114, a governor's proposal related to tribal EIDBI reimbursement rates has a fiscal impact of $27,000 in fiscal year 24-25 and a $46,000 impact in fiscal years 26-27. Moving down to line 130, a governor's proposal that increases rates to positive support services. This proposal totals $891 in fiscal year 24-25, and then $2.1 million in the tails. Next, moving down to line 143, a proposal from SF7 that fully phases in elderly waiver homemaker rates, as well as includes inflationary adjustments, is included in the bill for a total of $28.5 million in the first biennium and $49.9 million in the second biennium. So now moving down to the next proposal on line 147, this is a governor's proposal that is also included in Senate File 7. And I'll note here, the Senate File 7 numbers include amendment language. This is just, this is how the fiscal notes were submitted. So if members are interested in, or members of the public in identifying the fiscal note for a particular proposal, that is why those are included. So this proposal in particular relates to increasing the paid hours limit for parents and spouses of CFSS and CDCS that is included in the bill, and that is a fiscal total of just over $4 million in the first biennium and $7.3 million in the second biennium. So now moving to page 3. Line 153 is a governor's proposal that is included that modifies labor market reporting to include direct support professionals. So the fiscal impact of this proposal is $678,000 in the first biennium and $654,000 in the second biennium. The next proposal is included on line 159. This is a governor's proposal that increases direct support connect and disability hub access. This proposal includes, it has a fiscal impact of about $1.2 million in the first biennium and $1.3 in the second biennium. Moving on to line 168, this governor's proposal related to Community Innovations Workforce Grant is included. The fiscal impact of this proposal is about $4.4 million in the first biennium and $4.4 million in the tails. So moving on to the next proposal included is on line 178. This proposal is from Senate File 7 and relates to recommendations for establishing a life sharing services benefit and has a fiscal impact of $90,000 in fiscal year 24-25. The next proposal is on line 188, and this is from Senate File 7 and increases the rate and the rate floor for ICF and DD. The fiscal impact of this proposal is about $25 million in the first biennium of the budget and just over $25 million in the second biennium. Moving on to page 4, the next proposal that is included is on line 199. This is from Senate File 7 and makes modifications to the DWRS framework. The fiscal impact of this proposal is $111.4 million in the first biennium and roughly $280 million in the tails. The next proposal included in the bill is on line 204 from Senate File 7 that allows for respite services to be paid at market rate. So this proposal, the fiscal impact of it is $109,000 in the 24-25 biennium and $36,000 in the tails. Moving on to the next proposal on line 208. This is from Senate File 7, which modifies the Employment Exploration Wage Index. This has a fiscal impact of $228,000 in the first biennium and $448,000 in the 26-27 biennium. So moving on to the next proposal included, this is on line 213, Senate File 7, from Senate File 7, and modifies shared services. This has a fiscal impact of $417,000 in the first biennium and $43,000 in the 26-27 biennium. So now moving on to line 222, this is the governor's proposal related to PCAs, the Community First Services and Supports Rate Framework modifications. This proposal is included in the bill and has a fiscal impact of about $298 million in the first biennium and $478 million in the 26-27 biennium. So moving on to page 5, the next proposal that is included in the bill is located on line 232. This is PCA driving needs for personnel eligibility and was included, I believe, in both Senate File 7, but also Senate File 1597. So this proposal has a fiscal impact of about $1.7 million in the first biennium and no fiscal impact in the tails. So moving on to the next proposal, it's located on line 238. It's the governor's proposal related to HCBS provider rate increases as well as CDCS budget increases. So the fiscal impact of this one is about $40.4 million in the first biennium and $96.7 in the second biennium. I'll note here there's one difference between the governor's proposal and what's included in Senate File 2934. That is, the Senate file removes the customized living provision because there's overlap in another provision that I will note later. So moving on to the next proposal included is on line 252. This is from Senate File 7. It makes modifications to the EW or elderly waiver rate floor for disproportionate share facilities. This proposal has a fiscal impact of just over $10 million in the 24-25 biennium and about $15.8 million in the tails. Moving on to the next proposal included in the bill is on line 257. It's the governor's proposal related to critical access nursing facilities. This has a fiscal impact of $1.9 million in the 24-25 biennium and $2 million in the tails. So moving next to line 261, this is a governor proposal related to Vulnerable Adult Act redesigns. So this proposal included in the bill is about $53.7 million in the 24-25 biennium. So as compared to the governor's budget, the amounts were, the full amounts, I believe, were included in the first biennium, and they would be able to be expended through 2027. However, the grants included in this proposal would not be ongoing. And there's a few more proposals that have the same structure, and I'll try to identify them as I'm going through. So moving next to line 270, this is a governor's proposal related to long-term care workforce grants for new Americans. This has a fiscal impact of $20.2 million in the first biennium and follows the same structure of the grants being higher grant amounts included in fiscal year 24 and 25. However, those funds would be available through fiscal year 2027, but the grants would not be ongoing. Moving to page 6, the next proposal included is on line 277. This is a governor's proposal that makes the provider capacity grant program funding temporarily ongoing. So this proposal has a fiscal impact of just over $15 million in the first biennium. And similarly to what I just described, the grants would be funding would be available through fiscal year 2027, but the grants would not be ongoing beyond that. Moving to line 284, a governor's proposal that that relates to a long-term care actuarial study. So that proposal has a fiscal impact of $476,000 in the first biennium and no fiscal impact in the tails. Moving to the next proposal included, it's on line 303. It's a governor's proposal related to waiver services accessibility study. This has a 24-25 biennium impact of fiscal impact of $548,000. Moving to line 309, a governor's proposal that relates to HCBS curriculum and implementing training plan. The fiscal impact of this proposal is $1.35 million in the first biennium and $416,000 in the 26-27 biennium. So now moving to page 7, the next proposal included in the bill is on line 315. This is a governor's proposal related to technology investments to address HCBS workforce challenges. This proposal has a fiscal impact of $757,000 in the first biennium and $810,000 in the tails. The next proposal is on line 321, a governor's proposal that establishes a temporary customized living provider grant. This proposal has a fiscal effect of about $1.8 million in the 24-25 biennium and $208,000 in the tails. So moving next to line 328, this is an SF7 proposal that increases rates for BI and CADI customized living. So this is the proposal I referenced earlier that was an overlap with the governor's proposal that was eliminated. So this proposal has a fiscal impact of about $13.9 million in the first biennium and an estimated a fiscal impact of $33.1 million in the 26-27 biennium. Moving to the next proposal, located on line 332, it's a governor's proposal that establishes assisted living facility closure payments. This proposal has a fiscal impact of about $944,000 in the first biennium and $1.8 million in the 26-27 biennium. So now moving on to page 8. Line 370, located in the middle of the page. So this proposal is a governor's proposal that expands the MinChoice's operational budget. This would have a fiscal effect of about $3.7 million in the 24-25 biennium and $4 million in the 26-27 biennium. Moving to the next proposal included in the bill, located on line 382, is a governor's proposal related to addressing the HIV epidemic in Minnesota. The fiscal effect of this would be as included in the bill would be 10.1 million in fiscal year 24-25. Moving to page 9, the next proposal included is located on line 408, a governor's proposal related to improving quality of substance use disorder treatment and addressing administrative burdens. This proposal has a fiscal effect of about 2.25 million in the 24-25 biennium and about 2.4 million in the fiscal year 26-27 biennium. So moving to the bottom of page 9, the next proposal included is on line 428. This is a governor's proposal that makes traditional healing grants ongoing, and this has a fiscal effect of about 2 million in the first biennium and 2.2 in the 26-27 biennium. So moving now to page 10, line 432. Is a governor's proposal related to ongoing funding for the overdose prevention grant. This would have a fiscal effect of about 100,000 in the first biennium and 200,000 in the tails. The next proposal included is located on line 436. This is a governor proposal that corrects a drafting error that prevented grant funds from being expended. You'll note on the governor's revised budget, there was some administrative costs related to administering the grant fund. So the technical correction is fixed in the bill, but the administrative funds are not included in the bill. So moving to the next proposal, line 442. This is a governor's proposal related to competency-based training funding for substance use disorder provider community. So this proposal has a fiscal effect of about 606,000 in the 24-25 biennium and 636,000 in the tails. So moving next to line 448, this is a governor's proposal related to establishing a work group and startup and capacity grants for family substance use disorder treatment programs. So this is included in the bill and has a fiscal effect of about 10.6 million in the 24-25 biennium and 640,000 in the tails. The next proposal included is on line 456 and is a governor's proposal that requires naloxone on site for substance use disorder treatment facilities and certain public entities, and as well as some funding for training. So the total for this proposal that is included in the bill is 3.28 in the 24-25 biennium and about 3.3 million in the tails. Moving to line 461, a governor's proposal related to opioid and other substance use disorders, a youth public awareness campaign that is included in the bill and has a total of about 600,000 in the 24-25 biennium as well as in the tails. The next proposal included is located on line 465. It's the governor's proposal related to establishing a bad batch overdose surge text alert system. So this proposal is funded, included in the bill and funded at about 359 million in the first biennium and 359,000 in the first biennium and 372,000 in the second biennium. Moving to page 11, the next proposal that's included in the bill is on line 480. This is a governor's proposal related to funding for culturally focused programs to purchase clean needles, testing supplies, and naloxone. So this proposal is funded at just under 1.2 million in the first biennium and just over 1.2 million in the tails. And I do believe this had some policy modifications to it, but is funded at those levels. Moving next to line 486, this is the governor's proposal related to technical assistance for culturally specific organizations. So this is included in the bill at 5 million in the 24-25 biennium, and this is another example where the funds would be available through 2027. And that's all I had for that one. So moving on to the next proposal on line 493, this is a governor's proposal that makes recovery community organization grants ongoing funding temporarily. So this is included in the bill and includes a total of $6 million in the first biennium, and then that would those funds would be available through 2027. Moving on to the next proposal that's included in the bill, it's on line 502, governor proposal related to providing additional funding for training the peer workforce. This again is an example of front-loaded grants that are available through 2027, and the total for that proposal is $4.25 million. So moving to the bottom line on page 11, line 507, this is the governor's proposal that it provides startup grants for culturally specific recovery community organizations. And this is, again, an example of the grants being included, grant total of $4.4 million being included in the first biennium, but those funds would be available through fiscal year 2027. Moving to page 12, the next proposal included in the bill is on line 518. This relates to modifying the eligibility for recovery community organizations. This proposal is funded at $299,000 in the 24-25 biennium, and then $408,000 in the tails. The next proposal included is on line 523. This is a governor's proposal that includes counties as eligible vendors of medical assistance peer services. So the fiscal effect of this proposal is $170,000 in the 24-25 biennium and $270,000 in the tails. The next proposal that is included is on line 534. This is a governor's proposal related to expanding Project ECHO. Both this and the proposal below both relate to Project ECHO, but have a different focus. So the proposal on line 534 establishes opioid treatment-led practitioner hub. So the contracting cost for this proposal for the opioid treatment program would be roughly, $536,000 in the 24-25 biennium and $800,000 in the tails. Also note that this also has a fiscal impact, a non-general fund fiscal impact to the opiate epidemic response fund of $400,000 ongoing. So now moving to line 541, this is the other Project ECHO proposal that establishes 4 substance use disorder focused programs. So this is funded at $2.9 million in the first biennium and $3.2 million in the second biennium. Moving to page 13, the next proposal included in the bill is located on line 547. This is a governor's proposal that modifies the opioid treatment program rate methodology. So the fiscal impact of this is $746,000 in the first biennium and $702,000 in the 26-27 biennium. The next proposal included is on line 557. This is a governor's proposal that funds a medical assistance demonstration waiver study. The cost of this is $616,000 in the 24-25 biennium and $224,000 in the tails. The next proposal included is on line 563. This is a governor's proposal that includes a startup and capacity building grants for withdrawal management. This is funded at $3.9 million in the first biennium, and this is again an instance where the additional funding is provided. The funding provided in the first biennium would be available through fiscal year 2027, but the grants would not be ongoing. Moving next to line 576, this is the governor's proposal related to making modifications to the direct care and treatment program. So the overall fiscal impact of this proposal would be net zero. However, you can see in the lines below that some of the difference, it nets out to zero. So there are additional components that nets out to a $0 general fund fiscal impact. Moving to the next proposal on page 14, the next proposal that is included is on line 589. This is the direct care and treatment maintaining the current service levels. The total fiscal impact for this proposal is $99.6 million in the 24-25 biennium and $116.8 million in the tails. The next proposal that is included is on line 598. It's a governor's proposal related to direct care and treatment, establishing an electronic health record system. So this proposal is included in the bill and funded at $25.9 million in the first biennium and $22.2 million in the second biennium. Next, on line 604, the direct care and treatment fiscal year 2023 operating deficiency is included in the bill with a total of roughly $4.8 million in fiscal year 2023. The next proposal included is on line 608, and this is a governor's proposal related to medical assistance employment or employed persons. This is the MAPD, EPD proposal related to making modifications to that program as well as conforming changes. The fiscal impact of this would be $250,000 in the 24-25 biennium and $84,000 in the second biennium. Moving next to line 612. This is a governor's proposal that establishes Medicaid sanctional behavior standards for unsafe opioid prescribing practices. This is included in the bill and funded at $272,000 in the 24-25 biennium, as well at that same amount in the 26-27 biennium. So moving next to page 15, the next proposal included is on line 625. So this is a proposal contained in Senate File 7 related to increasing rates for non-emergency medical transportation. The fiscal effect of this proposal is $10.6 million in the 24-25 biennium and $15.7 million in the tails. Moving next to another NEMT proposal on line 631. This is also from SF7. So this this is an NEMT and ambulance services proposal that provides fuel adjustments. This proposal is included and funded at roughly $1.9 million in the first biennium and about $1.7 million in the tails. Moving to the next proposal included, it's on line 639. This is a governor's proposal related to improving the MA experience for people with disabilities. This proposal is funded at the governor's level total of $8.5 million in the first biennium and $5.9 million in the 26-27 biennium. So moving next, on line 645, this is both a governor's proposal as well as there is a Senate File 2616 related to this topic. This is the MA internal feeding product rate methodology change. So this proposal is funded at $3.3 million in the first biennium and $5.1 in the 26-27 biennium. So moving next to line 653, the Office of Ombudsperson for Long-Term Care Staffing. This is both a revised governor proposal as well as what's included in Senate File 2796. So the total included in Senate File 2796 were included in the bill. So that would be a fiscal effect of roughly $3.7 million in the first biennium and just over $4 million in the 26-27 biennium. So the next proposal is located on line 657. So this relates to MA income spend down and limit modification. So this proposal has a fiscal effect of $5 million in the 24-25 biennium and $5 million in the tails. And I'll note with this, there's this proposal, there is placeholder language included in the bill, and that will be updated after receiving TA from the department. So moving to line 661, this proposal is from Senate File 758, modifying community residential setting licensure requirements. That is included in the bill and has a fiscal impact of $315,000 in the 24-25 biennium and $330,000 in the 26-27 biennium. So now moving to page 16, the next proposal included in the bill is on line 668. This is from Senate File 759 and establishes a hospice respite and end-of-life care MA benefit for individuals under 22 years old. So this proposal has a fiscal effect of $159,000 in the 24-25 biennium and $190,000 in the 26-27 biennium. The next proposal included is on line 673. This is from Senate File 902 and increases rates for home care services. The fiscal effect of this bill is $64.3 million in the first biennium and $99.6 in the tails. So next on line 680, Senate File 993 establishes HCBS workforce invested fund grants. So this bill has a fiscal impact of $42 million in the 24-25 biennium and then 5.6 in the tails. And also note here, there's a separate fiscal cost associated with this bill for another agency that I'll cover at the end. So moving on to line 687, the next proposal included in the bill is from Senate File 1020, Essential Community Service Modifications Respite Service Grants Extension. So this is funded at $6.876 million for the 24-25 biennium. And I think compared to the underlying bill language, this was another example of the additional funds being provided in the first biennium for the grants, which would be available through 2027, but would not be ongoing. Moving next to line 696, this is a proposal from Senate File 1201 that eliminates parental contribution fees for TEFRA. The fiscal impact of this proposal would be $21.2 million in fiscal year 24-25 and $26.75 in the 26-27 biennium. So moving to page 17, line 704, the next proposal included is an MAPD premium modification asset limit elimination proposal from Senate File 1272. This is included in the bill and is the fiscal impact is $78.3 million in the 24-25 biennium and $154.4 million in the 26-27 biennium. The next proposal included in the bill is on line 712. This establishes a funding mechanism for PACE and was from Senate File 1640. This has a fiscal impact of $265,000 in the 24-25 biennium. Moving next to line 718, an emergency grant program for autism spectrum disorder treatment. This is from Senate File 1765 and is funded at about $21.15 million in fiscal year 24-25. This is again another example of the grants would be made available in the 24-25 biennium at a higher amount than I believe was originally funded and would be available through fiscal year 2027. Moving next to line 724. This is there's a number of proposals coming up that make modifications to nursing facilities rates. So this one is from Senate File 1769, which impacts Fergus Falls Nursing Facility. This has a fiscal impact of $412,000 in the 24-25 biennium and $603,000 in the tails. The next proposal is from the amended version of Senate File 1788, which was heard in the committee on Monday. And this amends the property rate payment, increases the property rate payment to certain nursing facilities. So the nursing facilities that are included are those with a project approved prior to January 1st of 2020, but were not completed by January 1st of 2020. And the fiscal note indicates that this applies to 3 nursing facilities in Minnesota: the Chosen Valley Care Center, the Ling Blumston Care Center, and the Viewcrest Health Center. So moving next to line, and I apologize, so this has a fiscal impact of just under $700,000 in the 24-25 biennium and $875,000 in the 26-27 biennium. Moving next on line 734, Senate File 2477, which increases the payment rates, property payment rate for the Chisholm nursing facility. This has a fiscal impact of $85,000 in the 24-25 biennium and $71,000 in the tails. The next proposal on line 738, this increases the rate for the Red Wing Nursing Facility. This is from Senate File 2896 and is funded at a fiscal impact of $199,000 in the 24-25 biennium and $359,000 in the 26-27 biennium. So moving to page 18, the next proposal that's included in the bill is located on line 742. So this is a nursing facilities rate increase to the total payment rate. This is again an example, as I mentioned earlier, of a bill where there's placeholder language included, and that will be substituted with once receiving TA from the department. So this proposal is funded at just over $70 million in the 24-25 biennium and about just over $47 million in the tails. Moving next to line 746, this proposal establishes Live Well at Home grants. This is from Senate File 1902. This is funded at $63 million in the 24-25 biennium, and this again is an example of the funds. This funding level would be available through fiscal year 2027. Moving next to line 755. This is from Senate File 1926 and amends the county cost liability for civilly committed persons being discharged. So this would include funding of roughly $6.6 million in the fiscal year 24-25 and $6.6 million in the tails. So this would result in a 50% cost share coverage by the state for counties, and I believe the underlying bill had 100%, so I just wanted to note that. Moving next to line 759, this proposal related to an appropriation for the senior nutritional program is funded in the bill at $32 million total for fiscal year 24 and 25. Moving next to line 765, this is a proposal related to supporting decision-making grant programs. This grant program being established. This is from Senate File 2397. This is funded at $4 million in the 24-25 biennium, and these funds would be available, grant funds would be available through fiscal year 2027. Moving next to line 769, so this is a proposal from Senate File 2529, a Douglas County Supplemental Housing Support Rate Creation. So this is funded in the bill at $971,000 in the first biennium and about $1.3 million in the second biennium. For this one, I believe there are updated fiscal notes coming for the amendment as the committee amended the bill on Monday. Those I checked, I believe it was about 8 o'clock this morning. It still wasn't updated. I'm not sure if we've received those since then. Next, moving to line 773. This is a proposal from Senate File 2944, establishing direct care services corpse pilot project. This is funded at $500,000 in the in fiscal year, the biennium, 24-25 biennium. So moving next to line 777. So this is from Senate File 3050 and includes a proposal that includes an appropriation for White Earth Nation digital therapy tool. This is funded at just over 4.1 million in the 24-25 biennium. Moving to page 19, the next proposal included in the bill is on line 783. This is a Wellness in the Woods grant related to Senate File 1568. This is funded at $200,000 in the first biennium and it is ongoing. Moving next to line 787. This is a proposal from Senate File 1391 that provides self-advocacy grants for persons with intellectual and developmental disabilities. This proposal is funded at $646,000 in the first biennium and is ongoing. Moving next to line 792, this is a proposal related to Senate File 2630, which provides a grant to family enhancement centers. This proposal is funded at $400,000 in the 24-25 biennium and is ongoing. Moving next to line 796, this proposal includes a Family Voices in Minnesota grant that is funded at $150,000 in the 24-25 biennium and is ongoing. Moving next on line 800 to Motion Analysis Advancements Clinical Study. This is funded at $400,000 in the 24-25 biennium and is a one-time appropriation. And now moving to the last Department of Human Services proposal on line 804. So this was in a proposal in Senate File 1692 related to HCBS Workforce Development Grant eligibility. So this was included in the DHS policy bill. It was determined that this, though it didn't have a cost, it would have a budgetary effect and should be included in the budget bill. So now moving to other agencies, line 949 shows the total for the Council on Disabilities. The Council on Disability is funded at $4.1 million in the 24-25 biennium and $4.57 in the 26-27 biennium. Moving next to line 959, this is funding for the Department of Management and Budget. This is related to a proposal that establishes an Office of Addiction and Recovery. So this proposal includes both what was included in the governor's proposal for MMB, but then also one additional FTE and totaling $1.8 million in the 24-25 biennium, and that amount is ongoing. So next, moving to the Ombudsman for Mental Health and Developmental Disabilities on line 964. The Ombudsman is funded at just over $2.6 million in the first biennium and $2.7 million in the second biennium. Moving now to page 20, the last proposal that's included in the bill. This is what I referenced earlier about funding for a different agency related to Senate File 993. This is for an awareness campaign for direct care professional recruitment. There's a fiscal impact to the Department of Employment and Economic Development of about it's exactly $4 million in the 24-25 biennium. So this is split up, as you can see, on lines 972 and 3 between grants and administrative fees. And Mr. Chair, that concludes my remarks.
Mr. Raymond, thank you for taking us through that line by line. Members, as you see, that was a nice broad overview, and it all connects to our DE. Any questions right now before we go to the hearing testimony? If not, I already see Senator Utke's got his yellow marker out, so that means he's got lots of questions on. Yeah, I love it. That'll be good. So either we can do that today, or we can do it Monday when we do the markup, Senator Utke. Senator Fate, go ahead.
Yeah, I'll just try to be quick. I just want to say thank you, Mr. Chair. I've enjoyed this committee because we've been able to take care of some of the most vulnerable members of our society, especially those in my district. And as we've seen throughout this session, we have a lot of folks living with homelessness as well as complex concurring disorders. And given that that's the reality within many parts of the state, especially within my district, my focus has always been on long-term care and specifically community-based services. So I just want to say thank you for demonstrating what is needed to address long-term care within the context of our hospital crisis, because we know that getting people out of hospitals is not enough. We need to get them in stable long-term care in community. So thank you so much.
Thank you, Senator Fate. You know, if you look at our work, it really started in the last biennium, you know, Senate File 6, which became Senate File 7. I mean, we started to address that crisis. You and I were part of that committee then, and so was other members on this board, and it was really to try to bring that through. So I appreciate your comments on that, to try to get a Senate position so that we can go into conversation. So, Senator Utke, did you have a comment? You just highlighting some stuff. Okay, so the members, Kyle Raymond, thank you so much again for your work. I know, and thank you for being flexible when I came to you saying, what if, what about, how come this, why can't I do that, what's that and that, and I appreciate your willingness to keep your pencil at hand to say, because every time we in this committee go to you and say, what if we pencil marked, it's affecting somebody's life, right? I mean, unlike, I'm not even going to compare us to other committees, but this committee, when we start talking about, you know, penciling in, what's it going to be? Somebody, it's affecting somebody in Minnesota, and I appreciate you keeping within that. So, members, with that, Senator Fate, one more comment?
I have a question.
Yeah.
Council, should be now or at the end?
You guys can do it now. I mean, if you want to wait till the end, you're fine. If you want to do it
I was
now.
just looking, and I took a couple of notes for council. Can you help point to some parts of the bill that go specifically towards expanding administrative capacity within DHS and the counties?
Mr. Raymond.
So there are proposals included in the bill that have administrative components to them that expand their capacity. However, the funding or the budget activities related to DHS administration is in Senator Wickland's committee, the Health and Human Services Committee. However, you know, I don't necessarily have the information in front of me, but I could identify and follow up with you for a couple of provisions that relate to what you're asking about.
Thank you.
Senator Fate, and then looks like Liam Monahan wants to. Mr. Monahan.
Mr. Chair, members, generally the administrative funding for DHS doesn't have any separate language. It's a number that's incorporated in the appropriations article. The appropriations article hasn't been written yet. It will be written over the weekend and be made available on Monday. So the funding will be in the number. On occasion, there's a rider that may describe something specific that the legislature is asking the department to do with that money. But generally speaking, the money ends up in the totals. The spreadsheet is associated, has administrative funding associated with the proposal. So if we've asked the department to do something and we've appropriated the money, they need to devote that money to that task. It's rare that there's language specifically saying use this particular amount to do this particular administrative task.
Senator?
Yeah, thank you so much. That was very helpful, Mr. Monahan. I just wanted to get a sense of how many FTEs would be created and how they'd be distributed as well.
Thank you, Senator
Thank you.
Fate. All right, members, thank you, Mr. Raymond. We have until 1 o'clock, and we have 34 people. It looks like the 3-minute, 102-minute piece. What I'm going to try to do first is I identified 1 minute, please.
She's online, he's here.
Got it. So Sarah's on. All right. So let's going to do this. What I'll do is the time limit ones. Josh, why don't you come on up, and then Sarah Kashner, you're online. You're number 2, and then Commissioner, I'm going to go do since nobody else has time limits on that, then we'll get to the folks online. It's so good. Commissioner Conley is with us from Hennepin County. So 1 minute again. All right. Well, I guess she just got off. So, hey, I feel like this is a radio show sometimes, Josh. How are you? Mr. Berg.
Mr. Chair, members, thank you very much. So does that mean I have 6 minutes, is what you're saying?
So, yeah, you got
I even got my timer. Mr. Chair, committee members, my name is Josh Berg. I am with a nonprofit called Accessible Space. Just wanted to take a few minutes today to thank you all for the hard work that you have done. I was thinking back to November 29th being the first hearing that we kind of started this process this session, and the journey that it's been and the process that it's been. I've learned a lot. I've gotten to know some of you folks a little bit better, which has been tremendous for me to be a part of, and I just thank you for all your hard work, the energy. I know it's not done yet, and you have lots to do. I wanted to echo just a couple things that as Chair Hoffman actually mentioned this morning on NPR. I heard it in the car this morning of, there's a lot in this bill already. I could run down the list of awesome things that are being accomplished. Really it's our job now to call on the governor, Speaker Hoffman, Senator Dietzick, to get us that extra $570 million that this committee would judiciously spend and put to even more tremendous ways and opportunities that Senator Fateh kind of highlighted too, how we can help folks across this state and in these communities. We could run down the list. I'm sure you're going to hear about some pieces that maybe were left out or modified. But with that said, you guys had a tremendous challenge in front of you. We're given what you were given. Hopefully, the governor and lieutenant governor who were gracious enough to join us at the Disability Day at the Capitol, that you, Chair Hoffman, and Senator Abler and others were able to be at, really echoed that sense of, we want to invest in some of these services and supports for some of our most vulnerable. There is more that could be done, most definitely. But for the most part, you guys knocked it out of the park, and we don't get to say that, or I don't get to say that very often. Sitting up here, it's a lot of asks, it's a lot of complaining, it's a lot of pointing out things that where there's gaps. But just know that with everything that you're faced with and the targets that you were given, I think you did a tremendous job, and we thank you. I thank you. Do I want to see the ICS RN clinical piece incorporated? Absolutely. We're going to keep fighting for it, 100%. But we also know that you have to do what you do, and you'll have us advocating on this side of it, reaching out to the governor, reaching out to the lieutenant governor, like I said, speaker, and whatnot. But thank you for your time. Look forward to the next few weeks to watch you guys do your thing. And if there's any additional assistance or support that is necessary, phone call, email, text away. So thank you very much.
Thank you, Mr. Berg. Thank you for your advocacy, and thank you for your help throughout this process. So, Sarah Kastner, you're welcome.
Hello, thank you. Senator Hoffman and members of the Human Services Committee, I come before you today on my birthday, so thanks for letting me go second as I try to fit in a million things between kids and work. I want to thank you for including SF 925 in your omnibus bill, which increases the number of paid hours a parent or spouse can provide to a person receiving personal care services through CDCS and CFSS. As a parent of not one, but as you know, 2 boys that suffer from a rare genetic progressive and eventually terminal disease called Duchenne muscular dystrophy, passage of this legislation this year will give me the opportunity to dial back at my job so I can provide personal assistance services to my children under the CDCS and hopefully live a more desired lifestyle for my kids and my family. The disability services workforce shortages has also left families in challenging situations when it comes to finding this personal care staff. So raising the cap on this number of hours a family member can provide in personal care services would reduce stress and just help ensure that people receiving services have a loving and reliable person to care for them. In addition to the workforce shortage, many parents and spouses would actually prefer to care for a family member when they know they have an abbreviated life expectancy, such as my two boys who are 7 and 9. So thank you to the authors of SF 925, Senators Bolden, Abler, Make-Wade, and Mann, along with Chair Hoffman, who included this in the Caregivers Stabilization Act, who he authored, and in this committee omnibus bill before you today. Passage of these provisions would be so helpful to many Minnesota families with loved ones with disabilities, including my own, and support and recognition of this need is so, so greatly appreciated. So thank you for advancing the provision that's important for loved ones with significant disabilities and abbreviated lives, and for the opportunity to come before you today and testify.
Thank you. That was 2 minutes and 17 seconds. That kind of sets the bar. Thank you for that. And that was succinct and to the point. I don't know if you remember the story years ago. In the other body, a certain senator that sits at this table was the vice chair of Representative Huntley's committee, and he had to get through 30 people, it was that setting the stage. You set the bar on that, so thank you for that. So we'll go online. It looks like Commissioner Connolly is not here. We have Idil Abdul, who's online. Ms. Abdul, welcome to the committee.
Good morning. My name is Idil Abdul. I am a Somali autism mom, advocate, and an EIDBI provider. I oppose Senate File 1593 for the following reasons. It is not cost effective and it is redundant. What is the fiscal note? And I know that you guys went over the funding for each area. Number two, DHS and the governor have already put a rate study for EIDBI providers this year, which will be more comprehensive and will include all stakeholders. This one did not and was solely by a group of non-Bloc EIDBI providers who, by the way, were against EIDBI when it passed in 2013 on a rainy Thursday in May. There are about 200 EIDBI providers in Minnesota. 60% of us are minorities. We were not at the table for this bill. There is no waiting list for assessments, as the other mom who spoke on Monday has stated. I am an EIDBI provider. I have a master's degree in behavior analysis, and we can do CMDEs in less than 30 days. What creates, Mr. Chair and members, what creates, maintains, and enhances racial disparities is when two people who are similarly situated are treated differently. I'm a Bloc autism mom who was denied to speak about this bill on Monday, while a non-Bloc autism mom was given 10 minutes or until she finished to speak. Finally, if you want to decrease racial disparity, then be fair, treat us equally. You don't have to like us, but you have to treat us fairly in publicly funded programs and in public committees. And I've timed myself and I'm well below 3 minutes. Thank you for your time.
Thank you, Ms. Abdul. Next is Lynn Noren, who's the president of RISE and chair of MOHAR.
Good morning, Senator Hoffman and members of the committee. My name is Lynn Noren, and I'm the president of RISE, an organization that provides employment and day support to people with disabilities. I'm also the chair of the Government Affairs Committee of MORE, which is a statewide association of over 100 nonprofit organizations providing employment and day supports to Minnesotans with disabilities. We so appreciate the opportunity to testify today in your committee on the Omnibus Finance Bill. I will echo many of the other testifiers and thank you for your hard work on this bill. We know that this is a time with many important human services needs in our state. We'd like to thank you for the investments in the disability waiver rate system that are included in your Omnibus Finance Bill. Over and over this session, we have repeated this simple reality. If we as a state value Minnesotans with disabilities living engaged and connected lives, then our state set reimbursement rates must be set at a level to pay for the staff supports that are necessary to make that possible. Proposals in this bill are extremely impactful steps in this direction. Thank you so much for fully funding the competitive workforce factor This factor of DWRS is intended to recognize the incredible work that our direct support professionals do, and fully funding that factor demonstrates the value to these workers. Additionally, thank you for the proposal to update the wage data that informs the employment exploration reimbursement rate. While this is a relatively small proposal with a very low cost, this proposal will help increase access to this service, focused on helping people with disabilities gain exposure to competitive integrated employment options. Lastly, we want to thank you on the multiple investments in the bill that are aimed at strengthening the workforce pipeline and retention outcomes, including retention grants, the Direct Service Corps project, and more. We have listened as your committee has had many discussions this session about the incredibly challenging workforce shortage that is resulting in Minnesotans with disabilities experiencing significant access barriers. We definitely struggle with this every day at RISE. Thank you for taking meaningful steps to address this crisis with the critical investments proposed in this bill. We look forward to partnering with you for the remainder of the session and to do all we can to address the workforce shortage and to help more people with disabilities access the supports they need to live engaged and connected lives. Thank you so much for your time today, and I'm here to answer any questions you have.
Thank you, Ms. Noren. Next up is Dr. Brian Gran, who is the Director of Integrated Opioid and Addiction Care at Echo Hennepin Healthcare. Doctor.
Mr. Chair, committee members, my name is Dr. Brian Gran, and I'm the Director of the Integrated Opioid and Addiction Care ECHO and oversee the substance-related ECHO initiatives here at Hennepin Healthcare. I'm also a proud graduate of the Addiction Medicine Fellowship in Minnesota and appreciate the opportunity to share the expertise gained in my training with providers across the state and our region. I want to thank you for including ongoing funding for Project ECHO in this omnibus bill. Project ECHO is a telementoring program that in Minnesota has focused on expanding capacity for treating opioid use disorder and other substance use disorders in primary care settings, and more recently helped build our state's capacity to care for people struggling with these conditions in emergency departments and OB women's health clinics. This is a program that we know works to multiply knowledge and the provision of high-quality care across our state, especially in rural and underserved areas where there may not be the specialists needed to treat addiction and related conditions. The state's own Minnesota Management and Budget team proved this in 2 separate reports and including a peer-reviewed published article in the Journal of American Medical Association. In Minnesota, Project ECHO has already made a huge difference. Nearly 1,800 physicians and other providers, as well as their teams, and 393 clinics and 245 unique zip codes have attended Project ECHO. ECHO connects healthcare teams to a learning community that stretches from Ortonville to Grand Marais, International Falls to Casson, and Redwood Falls to Minneapolis. We've addressed the recognition, management, and communication related to opioid disorder, mental health issues, maternal fetal issues related to substance use, complicated pain, including non-pharmacological pain management, culturally specific practices, and other medical conditions such as viral hepatitis, COVID-19 prevention and management in nursing homes across the state, and very importantly, race and equity issues related to opioid use, pain, and addiction in BIPOC communities. The funding that you've demonstrated there will allow Hennepin Healthcare to continue current work through the Project ECHOs and associated initiatives and add additional culturally responsive programs to serve our diverse communities. So thank you again for your efforts, and thank you for your support and time.
Thank you, Doctor. Thank you for your work. And with that, we're going to go to Barbara Dietz, who is the Human Services Director of Brown County. Welcome, Doctor. Welcome, Barb.
Good morning, Chair and members of the committee. My name is Barb Dietz, and I'm the Human Services Director for Brown County. I'm here today on behalf of the Association of Minnesota Counties, the Minnesota Intercounty Association, and Minnesota Association of County Social Service Administrators, where I am the co-chair of the Adult Services Committee. I'd like to testify in support of several provisions in this bill. First, we are grateful for the funding to continue work with the state, county, and stakeholders on the Vulnerable Adult Act redesign. Our original act was passed in 1980 and is in serious need of redesigning to match our state's changing demographics and current challenges within our existing statute. We're supportive of moving forward with all stakeholders to look at tools such as our Adult Abuse Reporting Center to ensure that all the tools are necessary to protect vulnerable adults from abuse, neglect, and financial exploitation. We also appreciate the provision carried over from the governor's bill that adds counties to the list of eligible vendors for medical assistance billing for peer recovery supports. As our state moved to a direct care model for substance use disorder, many counties are trying to be creative in what they can offer to fill the gaps when individuals don't have access to a provider. Peer recovery supports are part of filling that gap, and while not every county is going to participate in this, it will be very helpful for those that will. Counties also support the many provisions related to workforce, particularly the professionals caring for individuals with disability and in long-term care facilities. Working directly to connect individuals in need of disability services or long-term care, counties are very aware of the staffing shortages and strains on providers who are bound by rigid state reimbursements. This is particularly significant to skilled nursing homes in greater Minnesota, including Oak Hills Living Center, which is located in my own county of Brown. 3 skilled nursing homes within 25 miles of our county borders have closed in the past 2 years. We cannot afford to lose more resources in our part of the state. Thank you also for considering the ICF rate floor increase, increases in home and community-based provider rates, the long-term care workforce grants for new Americans, and the BI and CADI customized living rate increase. We also applaud the investments in our non-emergency medical transportation program through the rate increase and fuel adjustment. NEMT is critical to ensuring that all Minnesotans have access to healthcare services. Whether counties directly provide the service or utilize a broker, we experience challenges staffing and supporting these services. The fuel adjustment and the rate increase are a good step toward building this vital service back to adequate. I'd also like to thank the committee for reducing the county cost share for costs incurred when mentally ill and dangerous individuals are transferring from one state-operated facility to another. Thank you for recognizing that counties have no control over this transfer process or the availability of beds within state facilities. For a small county, one placement can be devastating to a budget when it's a cost of over $50,000 a month. We've been waiting over 2 months for placement of an individual who's supposedly at the top of the list. We will continue to advocate to eliminate this cost share, but we do appreciate very much this reduction. Speaking of state-operated services, I just want to note that this bill does not propose the separation of direct care and treatment as a new state agency, as is listed in the governor's budget. I mention this as we know it's going to be a topic in conference committee. For the last several years, counties have engaged with DCT in regular meetings to look at better ways to serve individuals, efficiencies in communication, and ways to build out our continuum of care beyond state-operated services.
Thank you, Barb.
Counties have expressed concern about a standalone agency and its potential effect of sibling conversations when we know that integrated care models have the best probability. We ask that conversations move forward so that counties can be a part of this conversation. In closing, counties appreciate many elements of this proposal. We look forward to continuing to digest the full proposal and are committed to partnering with you to ensure that Human Services budget passed is one of the best for Minnesotans. Thank you very much.
Barb Dietz, thank you so much. I was looking at your folks from the counties back there, and I'm going, don't you guys know how to do a time stop on this stuff? This is funny. Barb, thank you. Your work is just absolutely important, and I'm glad you're smiling at that. Mike Firth, how you doing? Park Hills Memorial. The county just ate into your time, so I'm kidding.
It's all right. I know.
Blame the counties, Mike. This is good. Go ahead.
My name is Mike Firth. I'm the director of the Oak Hills Foundation Board. Oak Hills is a nursing home in New Ulm, Minnesota. And in the previous months, we've talked to many legislators and tried to provide all the information we can about the serious problem of lack of funding that the nursing homes are experiencing right now. And I'm going to try a different approach. I know all of you and I have something in common. We all have imagination. If you didn't have imagination, you couldn't empathize with other people, and you do that every day that you come to work. You put yourself in someone else's shoes. Pretend with me for a minute that your house is on fire, and I'm the fire department. You call me and you say, I've used up all my extinguishers, I've dragged the garden hose in through the back door, and I can't put this fire out. I need help. The only people that can help me is the fire department. And you call them, and that's me. And you say, Mike, send the trucks. My house is on fire right now. And I say, I hear what you're saying. I'm going to send you over a few pails in an hour or two. And then just imagine with me the astonishment and the absolute bewilderment you would feel to hear the fire department tell you that. And you'd say, Mike, is this a joke? Why aren't you sending the fire department? And I would say, well, I know you guys have a problem, but some of the department they just don't want to come. And I'd say, well, wait a minute, you've got 17 billion gallons of water and you're sending me a few pails. I don't understand. And I'd say, well, I'm sorry, that's just how it is. Now, turn the tables for a minute, and you all are smart enough to know I'm speaking figuratively. Our house is on fire right now, and you're the fire department. What are you going to do? And in my house, there's 126 residents who cannot get out the door by themselves. There's 275 employees. They will all be out of a job and out of a home if the nursing homes don't get some additional funding as part of this budget. And I have yet to hear of any of it. Please be the firefighters we need. Please be the heroes that firefighters are, and send the water.
Thank you. The Senate position is trying to get the water into the fire gavel, so thank you so much, Mike, for that piece of it. So next we're going to go, I don't see anybody else that's online that I have on my list. So if you just want to have Commissioner Harpstead, then Sarah Grassman and Sue Abderhol, if you want to work your way down here, that would love that. And then this is funny, I'm going to say it anyway. Former Commissioner Kevin Goodnow, you're fourth on the thing. I had to do that because I see you in the back of the room. Toby Pearson and Aaron, you're going to be the next triad that comes down. So come on down, you guys. Sit at the table, please. Just because the county's ate into our time, Commissioner, so we can blame Matt Freeman for all that. So nice to see you, Commissioner.
Good morning, Chair Hoffman, committee members. I'm Jody Harpstead, the Commissioner of the Minnesota Department of Human Services. I want to express our sincere appreciation that your omnibus budget package includes and builds on so many of the governor and lieutenant governor's priorities for DHS programs and services in the area of human services. Your budget recognizes the urgency of addressing the opioid crisis in Minnesota. The committee knows well the deeply disturbing trend of overdose deaths is escalating. Minnesota also continues to have the worst disparities in the nation when it comes to opioid overdose deaths. Thank you for recognizing the need to fund key recommendations from the governor's budget to continue building our continuum of substance use disorder prevention, early intervention, and treatment to meet this critical moment. We look forward to working with you on the most effective investments we can make in this area to reverse the trends we're seeing and save lives. We appreciate your focus on the long-term care workforce and ensuring that every person in Minnesota who's doing impactful work of providing direct care support earns a livable wage. We appreciate your attention to workers who are the lowest paid in this sector and those who support people with disabilities and older adults in their own homes, such as PCAs, including ratifying and funding the SEIU contract agreement and your investment in services for older adults. These investments are needed to ensure these critical services are available to the Minnesotans who need them. We also very much appreciate your support for direct care and treatment in this bill by funding the deficiency request and the operating adjustment, as well as funding to create a long overdue electronic medical record. DCT is a critical part of our human services continuum, whose mission is to act as a safety net and serve people other providers cannot. This will allow us to continue providing these essential services at our current levels. Thank you so much for including other urgent requests from the governor's budget, such as filling the looming funding gap for services to support people with living with HIV/AIDS and building on this investment to meet more of the need. As you know, we are supporting the notion that people with disabilities in Minnesota should no longer be paid below minimum wage. And I believe you support our plan to separate direct care and treatment into its own agency, and we hope you'll work with us to support the funding needed to do that well. Thank you for all the work you've done this session to improve Minnesota's human services system and ensure the people of Minnesota have access to the services and supports they need to live their fullest lives. This bill provides investments that will truly change lives. We stand ready to work with you going into conference committee to build a budget that does just that. And it's a treat to sit here this morning between two of my favorite people.
Isn't that awesome? Thank you. And you need to know throughout this whole process that having access to Ms. Bailey and is just been absolutely. You just need to know your staff, Burdick and Christy Grom and Bailey, and the folks in the corner that Senator Abler brought. I don't know what even that was the other day when they were here. So tutory board or whatever the heck it's called. I'm not even going to try to attempt it. But you need to know your staff have been very accessible to every member on this committee, and I appreciate that. So thank you. Sarah Grafsman from ARM.
Thank you. Good morning, Mr. Chair and committee members. For the record, my name is Sarah Grafstrom, and I am the Director of State and Federal Policy with ARM, a trade association representing over 160 residential disability waiver service providers. Earlier this week, we had over 1,000 people filling the Capitol Rotunda for Disability Services Day at the Capitol. Rally attendees held up signs asking, "Do you see us?" and chanted, "Invest in us." We are so grateful to see that the Delete Everything Amendment to Senate File 2934 does just that. It invests in people with disabilities and their support staff, and just as the chair said from the podium, lets them know that they are indeed seen. We want to thank the chair and members of the Human Service Committee for the thoughtful dialogue and conversation this session around proposals that would make a positive impact on the workforce crisis within disability waiver services. Thank you for the opportunity to highlight a few of those proposals that we are pleased to see included in the bill. First and foremost, we want to thank the chair for including sustainable investments in the disability waiver rate system, specifically fully funding the competitive workforce factor. ARM and our members have been in front of this committee all session sharing stories of the catastrophic workforce crisis and the impact it has on services that support people with disabilities. Unlike other industries, our members have signed up to support people with disabilities where they live. That's a different take on the workforce crisis because our staff can't leave if there isn't someone to take over when a shift ends. We can't decide not to open for the day if we don't have staff to fill a shift. We can't work remotely if there's bad weather or close on weekends and holidays. Direct support professionals show up, they stay and continue to work, sometimes double shifts, sometimes triple. This needed investment in wages will not only support the retention of our current staff, but will also help attract desperately needed new staff into the profession. We are also grateful to see other investments made in meaningful workforce solutions for disability waiver services. We want to specifically highlight and thank the chair for including funding for the workforce recruitment and retention bonuses for direct support professionals, removing respite from the DWS framework and allowing it to move forward as a market rate service, the removal of the need of a separate license for providers when supporting individuals with AOST, language that allows for increased shared services for individuals living independently in their own home, language directing the commissioner to work with stakeholders on the development of life-sharing services, the proposed increase to positive supports, and the public awareness campaign aimed at bringing new people into the caring profession. Along with investments in waiver services, we also want to thank the chair for including a payment rate increase for ICFDD services. Over the years, ICFDD payment rates have been mainly stagnant. The increase proposed in the DE amendment will help sustain these important services and allow providers to align their staff compensation more closely with other residential settings. Finally, we want to thank the chair for not including the proposal for new family foster care rate tiers. As we have previously shared, we have concerns that the proposal as drafted would result in rate reductions for family foster care providers and would destabilize this important part of the service. And I will wrap up because I hear the alarm. We have said it before, but it's never felt truer than right now. Services that support people with disabilities are at a crossroads. This bill sends a clear message that direct support professionals do not stand alone. Thank you again for your work this session. As we continue to move through session, ARM and our members are committed to being a resource.
Thank you, Ms. Grafsman. Actually, as your Senator Abler's constituent, so members just note that you know, Senator Abler pulls a bunch of amendments on us on Monday that we can, right? You guys we're good. Thank you. Ms. Abderholden, it's good to see you. Kevin and Toby and Aaron, you want to start working your way down? I can do that. Go ahead, Sue.
Thank you, Mr. Chairman. Members, Sue Abderholden, Executive Director of NAMI, Minnesota, and I want to thank the chairman and the committee for their work this year. We support increasing the income limit under Medicaid for people with disabilities to lessen their spend down, and also increasing the asset limits under MAEPD to really provide more economic stability for people. We also support looking at covering traditional healing and behavioral health services in correctional facilities. I think that's really an important step forward. We also actually really do support separating direct care and treatment from the Department of Human Services. We really do believe it's a conflict of interest to provide, fund, and license services within one agency. There is a section on conducting a systemic review of acute care hospitalizations for people with disabilities and mental illnesses. I would add that it might be important to actually include consultation with stakeholders and actually the barriers that community providers face. We have a front door and a back door issue. You know, how can we prevent people going to the emergency room and being in the hospital, but also how can we make sure they move back to the community? We do support increasing PCA rates in particular. We know that children with mental illnesses who have complex needs just can't find anyone to work for them. Also want to say that we support eliminating tougher fees, which is an issue that I've worked on since the 1980s. And so it's nice that if you wait long enough, it will come around. Also, I just want to mention we support increasing the staff for the Ombudsman's office as well. They do have a lot of work to do, and we want to make sure that they can do it well. And lastly, I just found it interesting, the creation of the Division of Youth Substance Use and Addiction Recovery. We actually wish that we could go back to having a division of children's mental health as well. Thank you for your time this morning.
Thank you. Thank you. Mr. Goodnow.
Mr. Chairman, members of the committee, my name is Kevin Goodnow. I am here on behalf of the Behavioral Health Group, which is the largest provider of opioid treatment program services in Minnesota. Members of the committee, Senate File 2934 with the delete all is a great bill. It's doing a lot of great things. I just have maybe a slight suggestion on how to make it a little bit better. First of all, if you look at the delete all on page 152.1, we do have concerns about the governor's proposal with regard to revised payment methodology for opioid treatment programs. Under the DHS calculation, they're assuming that that's a budget neutral proposal. Not sure how they arrived at those numbers, what data they use, how they use the data, or the assumptions behind the data. But in our calculations, it will result in about a 30% reduction in the revenues coming into us as a provider, and we'll have some, at best, challenging implications for providers out there and access to OTP proposals in the future, and at worst, devastating impacts on those proposals. As an alternative, we would suggest looking at Senate File 2488. We had a great author with that bill, Mr. Chairman. This was a bill that mirrors the Medicare proposal with regard to the way the services are bundled and the payment mechanism for those as well. That would result in a rate increase for providers. Someplace in between that and where the governor's proposal is I think where we need to end up. But we are committed to working with you and the agency and others involved in this that really want to take care of people that are suffering from opioid use disorder, to try to make sure that we have a system that's accessible and that will be viable going forward in the future. So Mr. Chair, members of the committee, thank you for your time.
Thank you, Mr. Goodnow. And to let you know, that's one of the fiscal notes we're waiting on. It's 2488. It was a desire of this committee to really kind of embed that in there. I guess we still have work to do. Plus, you also mentioned on the opioid prescription improvement program, there's some language stuff in there that there's still not peace in the valley. And so between now and Monday, I want to have some language that absolutely places it. So the language that you see currently in there is not, we're going to make some changes. There's going to be some amendments on Monday that will hopefully clean that up. Because really what we have to do is some of the stuff is impacting, especially when it comes to the opioid prescription improvement program, it's impacting patient care. And it's been, even though it matches up, there's still some fixes that need to be there, and I appreciate you highlighting that, and we'll go with that. Now, I've got 27 seconds left of your time, so I just took it.
Mr. Chairman, members of the committee, thank you for your attention to this matter. We really appreciate it.
Thank you, Mr. Goodnow.
Thank you.
Mr. Pearson, welcome.
Mr. Chair, members, my name is Toby Pearson with Care Providers of Minnesota. Today, on behalf of the Long-Term Care Imperative, we'd like to say thank you for your investments and thank you for listening to us. Thank you for listening to us last week when we testified about the governor's budget, and we told you that recent data from our members indicated that seniors were turned away 11,000 times from assisted living or nursing home settings just 1 month. Metro hospitals are calling all over, 4 hours away to try to figure out where they can place some patients. Thank you for listening to us when we told you that there were 2,597 nursing home beds taken out of service statewide in the last 2 years. That's the equivalent of more than 50 50-bed nursing homes. Thank you for listening to us when we told you that our nursing facility settings have vacancy rates for open workforce positions of about 20%. We reminded you that the forecast increases reflect past payments, not future money, that forecast reflects projected growth based on past expenditures. It is not an infusion of money to help give our hardworking workforce the raises that they need. Let me share with you a few more false assumptions about the forecasted money that have been stated publicly by some. The forecast numbers that have been thrown around include both state and federal spending. It's highly unusual to combine those two in our conversations, unless, of course, you're looking for a really big number. For many years, nursing facilities have not spent up to the forecasted number because it assumes an occupancy threshold that we have not been able to meet. And our current admission holds, we can't guarantee that we will spend up to the amount. In fact, to illustrate, in 2018, they forecasted that the state share spent in 2022 would be just under $600 million. The actual state spend was a little more than $400. If they were to guarantee that what they are representing as state share spend of $850 million is real money, we would not be facing the dire situation we are currently in. Again, thank you. You heard us. And thank you for taking these important steps to address our concerns. And now I will turn it over to Ms. Hupert to walk through the details.
Ms. Hupert.
Thank you, Mr. Chair and members of the committee. For the record, my name is Erin Hupert with Leading Age Minnesota, here on behalf of the Long-Term Care Imperative. Collectively, we represent about 2,000 providers of long-term care services across the state, including adult day, assisted living, home and community services, and nursing homes. We very much appreciate the investments in aging services in the Senate Human Services Bill, specifically funding for nursing homes in the amount of $74 million over the 24-25 biennium, in addition to the governor's proposal for $4 million for critical access nursing homes. We appreciate the investment in elderly waiver with rate increases for CADI and BI customized living, and expanding the eligibility for elderly waiver disproportionate share. We are appreciative of inclusion of the actuarial study and implementation framework for PACE, the long-term care workforce grants, and assisted living closure grants. However, as Mr. Pearson said, we must raise probably two things for future consideration. First, the proposal does not address our other concern, the delay in payments to nursing homes, which, as you know, stretches nearly 2 years from cost report to rate notice. That is a really long time to float expenses when reserves have dried up. We know that this is a process, and we look forward to working with the committee to try to make that vital change. Finally, we do look forward to working with you on the creation of a long-term care access fund. As you know, we have underspent the forecast for years, and especially since the pandemic. If we were to receive $800 million of state and federal funds, again, as Mr. Pearson said, not sure that that is something we can actually achieve. Our members would be happy to take that money on the table to the bank and invest it in our workforce. So thank you very much for the opportunity to testify.
Thank you, Ms. Shepard. Thank you, Mr. Pearson. Thanks for all your work. Next up, we're going to go Don Simonson, Gail Larson, and Tom Gillespie, if you can work your way down. And then Kathy Messerly, Jeremy Kramer, and Sam Smith will be the next three after that. So, hey, Don.
Good morning.
Welcome back.
Thank you. Good morning, Chair Hoffman and members of the committee. Don Simonson, President and CEO of Trellis, the state-designated area agency on aging for the metro area. I co-chair this statewide Senior Meals and Services Coalition, and am here today representing the Minnesota Association of Area Agencies on Aging. Thank you for the opportunity to testify. First, thank you. We are very grateful for the appropriation of $16 million annually that you have included for meals for seniors in your budget. I have one ask, and it won't surprise you. Please add this appropriation to the base. We all know the population of older adults is increasing. Currently, more than 1 million older adults reside in Minnesota. The oldest participants in our senior meal program are silent generation seniors, and we are also serving the oldest of the baby boomers. And we know that the baby boom is an unprecedented large population cohort. The need for meals among low income and frail, vulnerable older adults will only grow. Elderly poverty in our state is real and a contributing factor to food insecurity. The University of Minnesota reported in April 22 that 1 in 10 older adults lives in poverty. For several years, Hunger Solutions has reported year-over-year increases in use of food shelves by seniors. Minnesota seniors made more than 700,000 visits to food shelves in 2022, up almost 40% from 2021. As a state, we have a collective responsibility to care for older adults in need. We cannot let seniors go hungry and suffer the consequences of malnutrition, serious illness, hospitalization, premature nursing home placement, and death. I call your attention to a Mayo Clinic study published December 2022, which found a 28% increase in deaths from malnutrition among women 85 years of age and older who resided in rural areas of Minnesota in 2020. Mayo's report notes that vulnerability to malnutrition increases with age and that depression and loneliness are important risk factors for malnutrition among older adults. Additional funding for meals will help prevent the very sad outcomes of malnutrition and isolation. Funding for meals is an upstream investment and meets a current need. The cost to the state for home-delivered meals and group dining is small compared to the costs of more formal and institutional care. Healthy meals are a core service to help older adults live in their homes for as long as possible, something so critical in today's environment. Seniors need your support now, thank you, and in subsequent years. But we know that one-time funding will not solve senior hunger and will not prevent wait lists in the future. In conclusion, thank you to Senator May Quaid for authoring Senate File 2244, and to all of you, Chair Hoffman, and members of the committee for valuing the lives of older adults and recognizing their basic need for food. Please consider adding the new appropriation for meals to the base so that seniors will have access to food and regular social contact in future years. Thank you.
Thank you, Ms. Simonson. Ms. Larson, welcome to the committee.
Thank you. Chair Hoffman and committee members, my name is Gail Larson and I live in Bloomington. I am testifying today to support the SEIU Healthcare Minnesota and Iowa. I am a PCA for my significant other. His name is Ronald and he is also a veteran. I have been his PCA for 13 years. Prior to receiving services, he had a brain surgery to remove a tumor that did not go as well as anticipated. Since then, he has mental health and physical health issues that require constant care. He suffers 24/7 migraines, he can't stand very long, and he falls easily. I dress him, plus I care for his daily chores and needs. With the help, he can live independently, and he works as a resident manager. First, I want to mention some other great items in the bill. To start, we support line 231 of your spreadsheet on personal care attendants to drive clients. We support line 269, which funds workforce grants to new Americans. Our members at Rainbow Health will cheer the HIV funding on line 381. Our members at Bayview Nursing Home will cheer for the rate increase on line 737. Our nursing home workers appreciate the new investment you make in facility rates. This new money will, when combined with other top priority, the Nursing Home Standards Board in the labor bill will raise the wages in the industry. However, I am here today because of the historic SEIU home care contract, which includes a minimum wage increase from $15.25 to $20 over the next 2 years. A $1,000 retention bonus for those who have worked at least 6 months. A wage scale with stepped increases up to $22.50 an hour. We also won the ability to shape an orientation program with DHS, which I really would have appreciated when I started. Higher wages will help me find other caregivers to help support. Since COVID, we have not been able to hire anybody to help. And as you have read, the horrific stories of clients who suffer and even die at home because they cannot find workers. My partner has me, but if I work as a full-time caregiver for him, that takes away the ability to do other work and for me to take care of myself. The extra wages will help be a financial boost for me and my family. We
we are excited to find a different living place because we live in a noisy building and neighborhood. So we look forward to that because my partner works nights and he has migraines all the time. So I hope you know how much this bill will do. Thank you for the bipartisan support for our contract, and please vote yes.
Thank you, Ms. Larson. Mr. Gillespie, welcome. And Ms. Kathy Messerly, Jeremy Kramer, you want to start working down too. So, Mr. Gillespie, welcome.
Yes, good morning, Chair Hoffman and committee members. First of all, thank you for taking testimony on this bill. It's important to us to feel heard in this process, so thank you. For the record, my name is Tom Gillespie. I'm the president and CEO of Living Well Disability Services. We're a provider of in-home and community-based services for people with disabilities. On my time today, I want to recognize your efforts and appreciate the bill that you've put forward, especially your efforts to raise as many rates and sort of recognize as many services as you have. So thank you for doing that. I want to specifically thank you for the inclusion of funding for ICF services, most specifically sections 39 and 40 of this bill. Through that, you are investing $50 per person per day for people in ICF services. You're also installing 2 rate floors, $300 a day for Class A facilities and $400 a day for Class B facilities, which typically have a higher level of need. It's important to note that folks who receive ICF services in the state of Minnesota oftentimes have more medically intensive and intensive support needs. And so waiver homes are at times often not an alternative for folks who are in ICFs. Their likely alternative for services is a nursing home or a hospital. So ICF services are a very important service in Minnesota because there's need there, and we're also relieving other critical systems that are, having the same staffing challenges that we are in terms of capacity. So there are actively dozens of people who need services, who are in hospitals and nursing homes right now. Our system is trying to get them out of those beds, but we don't have the staff and we don't have the people, and that's why we need this support. So I want to appreciate what you've done. I do have an ask today, selfishly. We need you to play defense on this thing. We need you to keep it in there as it is. The governor and the House proposals invest $50 a day, but they have a one rate floor of $260 a day across both types of facilities. It's important for you to know that's going to impact less than half of current ICF facilities in the state of Minnesota. And for those that are better funded right now, those proposals are looking for essentially regression to the mean. And so the best funded ICFs right now won't see any impact from their proposal for 30 years. And they won't be around by then, trust me. They'll go out of business because they won't have the support and they won't have the people that they need. So please play defense, sit on it, don't let it change. We need that, our system needs it. As we consider other rate increases to PCA and other DWRS rates, ICFs are not a part of that. And so if they don't keep pace, we won't be able to hire. For organizations like mine, we provide both waiver and ICF services. If we have to increase our starting wage for waiver, we also have to do that for ICFs, and that's a broken proposal without your support. So please do sit on it. But again, we appreciate it. Thank you. And again, thank you for hearing us today. That's an important part of our process. Thank you.
Thank you for the reminder of playing defense, especially in the Purple People Eater state. So, you know what? I understand it's your birthday today.
He didn't
What
really
a best
tell you.
way to spend your birthday than in front of the, welcome. It is everybody. Wish happy birthday to Kathy Messerly today. So that's happy birthday, Kathy.
He must have slipped you a text.
I didn't get any text. I'm looking at a timesheet. I'm eating into your time, by the way, since Matt Freeman allows people to do this. I'm just going to keep eating into people's time.
Well, thank you for the birthday gift.
You're welcome. Hey, welcome, Ms. Messerly. And Jeremy, and then Samuel, and then Cynthia. Calais, you're going to be next up online from there. And then, so go ahead.
My name is
you know
Kathy
what?
Messerly.
I just jumped ahead of Tom Gillespie, but that's okay. You go ahead, Miss Kathy Messerly, and then Tom will go to you. So I'm sorry. No, we just finished Tom. See, I got so flustered by the fact. No, Tom was just here. I got flustered by the fact that I was eating into your time and I was going to make fun of Matt and wish you a happy birthday, but now I just totally messed up my delivery. So welcome. Welcome, Miss Messerly.
Chair Hoffman, members of the committee. My name is Kathy Messerly, and I'm the Executive Director for the Minnesota Home Care Association. Our members provide hands-on care to older Minnesotans, young children with complex health conditions, and individuals with disabilities in their homes. Thank you for the opportunity to comment briefly today on your committee omnibus bill. I'm here today to say thank you for your investments in home care in the bill, for the home health and the home care nursing base rate, for the homemaker rates, and for the PCA rate increases. Your bill takes a bold step to address the foundational reimbursement rate challenges that are so significantly impacting access to care. And it will assist providers who are navigating numerous complexities as they strive to provide quality care, from the new mandate for electronic visit verification to paid leave to the simple demographic reality of the shortage of workers. We also appreciate the funding for a direct service corps pilot project and other workforce-related grants and initiatives in the bill. MHCA will continue to dedicate resources to various workforce pipeline initiatives as we recognize that a multi-pronged approach to our workforce dilemma is essential. Thank you for your investments proposed in this bill and for your support of Minnesotans who need home care services across the state.
Thank you, Ms. Messerly. Thank you very much. You just look at this. You just alluded. You did that in 1 minute and 30 seconds. So I get you that. Jeremy Kramer, nice to see you back. Welcome, and then welcome to the committee.
Thank you, Chair Hoffman and the members of the committee. My name is Jeremy Kramer. Thank you for your work on Senate File 2934. I'm the Counts and Customer Service Manager at Blue and White Taxi, and I've been in this role since 2010. We're the largest non-emergency medical transportation in the state of Minnesota. I've been working closely with MCOs and their members, as well as working closely with our drivers, who I'm here today to represent and speak up for. I understand their frustrations these days with rising prices, and it's not just about gas, it's about basically everything: maintenance, food, insurance, you name it. It's very important that I mention that Blue and White does not own these cars. Drivers and independent owners own these cars. Some are widowed wives, and nearly 90% of our fleet are from immigrant families who support their immediate and extended families. Our company has always been very proactive in supporting our drivers. When COVID hit in 2020, we had masks, gloves, and we're making disinfectant from our office. Protecting our drivers and our riders was our biggest concern. We constructed plastic shields and cabs from supplies at Home Depot before any company was even selling them, which wasn't until 6 months later. Our concern for Minnesotans having access to their critical medical care, dialysis, chemotherapy, mental health services took precedent over everything else. During the protests after the death of Mr. Floyd, public transportation went down. So we were the company that not only MCOs but the public turned to get help in the Minneapolis area. Even though despite the dangers, and even we lost one of our drivers during that time as he was trying to protect his vehicle from being stolen, and he was shot. The people of Minnesota understood the importance of what we were doing. We were awarded a Community Hero Award, which I guess was just a piece of paper. So I'm here to represent more than that for the drivers. I'm here to sincerely thank you for the rate increase of SF 2934. This is a federal law that prevents these drivers to get paid for every mile. There is a federal law that prevents drivers from getting paid for every mile. Sorry, if you call a plumber, they get to charge $90. If we show up and that member's not there, we don't get paid for that. It's a loss for the driver. We know that you're faced with heavy challenges in putting your budget together inside of your target. We're thankful for what was proposed, but we are continuing to request a base rate of $14 and a per mile rate of $1.95, slightly above what is included in the SF 2934. Last week I had an MCO reach out asking us to go outside of our 7-county metro to help in the surrounding metros. And our fleet since 2020 has dwindled by about 30%, but our ridership has increased, so you can only imagine that being able to help them is virtually impossible. Again, thank you for your time.
Thank you, Mr. Kramer. Welcome, Mr. Smith.
Chair Hoffman, members of the committee, my name is Sam Smith, and I'm here to testify on behalf of the Alzheimer's Association. The challenges facing the long-term care workforce are well documented, and we support efforts this budget bill takes to address this crisis. However, we are particularly grateful this bill also focuses on unpaid caregivers and the foundational role they play in keeping loved ones at home where they want to be and out of more expensive and intensive settings like an assisted living or nursing home. In 2022, 163,000 Minnesota caregivers provided 225 million hours of unpaid care for a loved one with dementia, valued at $5.259 billion. This comes at a cost. The stress and emotional toll of caring for a loved one with dementia leads to higher rates of chronic conditions like depression or hypertension, and caregivers are burning out at increasing rates. Caregiver burnout is the leading reason for placement in a more expensive residential setting. In a 2021 DHS-funded study on the trajectory of the elderly waiver in Minnesota, a key finding is that there is a progressive need that builds over years before individuals join the elderly waiver. This creates multiple contacts with the DHS system prior to eligibility and an opportunity to provide lower levels of support and guidance that may delay or prevent spend down to MA or more costly support through the MA or elderly waiver. Areas for opportunity include investments in the essential community supports and alternative care program, and providing earlier home and community-based supports prior to EW eligibility, end quote. We need to support Alzheimer's and dementia caregivers before they face a medical or financial crisis and require more intensive and expensive support. With this in mind, we are very supportive of items in this bill, including investing $6.876 million towards respite care for older adults and people with dementia, expanding access to respite care is a top priority, and we hope as the final budget is developed, we can secure base funding for this much-needed service. We are also very appreciative of the major investment this bill makes in the Live Well at Home grant program. This infusion of resources for this proven program will help more elders and people with dementia remain at home with the people they love and the community they know. We're also excited to see an investment in the PACE program. Thank you very much. A much-needed rate increase for the elderly waiver. Reducing the burden of the MA spend down is a welcome step in the right direction. Resources for nursing homes will also make a difference for our members. And we also appreciate the investment in the Office of Ombudsman for long-term care staffing. That's a welcome investment as well. Thank you for your time.
Thank you, Mr. Smith. Ms. Calais.
Thank you, Chair Hoffman and members of the committee. My name is Cynthia Calais, and I'm the Public Policy Coordinator with the Minnesota Brain Injury Alliance. I want to start by thanking you for the tremendous investment in our human service system you're making with this bill. We're excited and pleased to see the large investments in direct support workers and the service provider network that you make. These are people and organizations that provided much-needed care for people with disabilities. We can all see the disability services crisis in front of us, and this committee has an important role in its solution. This is a complex problem, and we appreciate these historic investments. In addition to improving the system, we also must make comprehensive progress in addressing the day-to-day issues that people with disabilities face. Truly improving the lives of Minnesotans who live with disabilities must go deeper than improving computer systems, adding FTEs to agencies, improving rates, and providing incentives for employment and caregiving. We must also strive to create a more equitable and just medical assistance program. So we want to thank you for including funding to begin to address the MA income limit for people with disabilities. This is an income limit that forces people with disabilities to live in deep poverty just to qualify for MA. Individuals with disabilities deserve care and support, and they should be able to afford to live independently in their community. People with disabilities and the elderly face the lowest income standards out of all the categories of MA. This means they have the least amount of money to live on each month while having higher needs. Currently, in addition to the strict income limits, an individual on MA can only have $3,000 in assets, while other eligibility categories have no asset limits. Thank you for including $10 million to begin to address the income limits for people with disabilities. As we have pointed out to this committee before, this amount is directly proportional to the amount of money that Minnesota is essentially taking out of people with disabilities' pockets. The cost of raising the income and asset standards fully is about $872 million. This bill is a start. If we do nothing to improve the income standard, it will continue the cycle of poverty that people with disabilities are forced to live in. Now is the time to move the needle and give people hope. This investment will have a direct impact on so many Minnesotans, and I urge you to continue this progress and fight to ensure it stays in the bill and ultimately sign into law. Thanks again for your significant investments and efforts to address inequity in our MA qualifying system.
Thank you, Ms. Calais. And to that point, members, that something that, we talked about the $1.825 billion and underspending. If we look at some of the things that we could actually take care of if we were able to capture the money that should have been spent, and be able to recycle that through the system, give it to the department with a list of stuff, things like this that we should really be taking care of would be something would be past tense conversation. So I appreciate you bringing that up. It looks like Aisha Elmquist, Jeremy Drucker, and Sue Hankner, if you want to work your way down. And then 3 after that will be Dr. Larson, Amanda Vikstrom, and then Dr. Johnson. So Deputy Ombudsman for the Office of Ombudsman for Long-Term Care. That's a long title, isn't it? Welcome.
Thank you, Chair Hoffman. Members of the committee, I'm Aisha Elmquist. I'm Deputy Ombudsman with the Office of Ombudsman for Long-Term Care. We are independent consumer advocates who investigate complaints and advocate for changes that protect the health, safety, welfare, and rights of long-term care consumers. Our office provides resident-directed advocacy in nursing homes, veterans' homes, assisted livings, and other long-term care settings. We are here today to testify in support of funding 17 additional FTEs for our office that is in the Omnibus bill before you today. Complaints to our office continue to rise, as we've previously detailed to this committee. We need sufficient funding and staff to respond to these complaints, which will likely only continue to rise with our ever-aging population. In addition to increasing our complaint work, we seek to provide more routine visits to facilities, including facilities where residents have never accessed our program before. Being present in facilities and meeting residents in person can be critical to them being aware of our program and being able to identify various issues in facilities. Last year, we were unable to provide almost 50% of assisted living facilities in the state with any visit. And we were also unable to meet our goal of providing nursing homes with a visit every quarter, which in fact is federally mandated for us. And we did not meet that goal for 30% of nursing homes. To show one example of the benefit of these visits, we recently visited an assisted living facility where improper supervision and an unsafe physical environment was provided for a resident at significant risk for self-harm. By providing this routine visit, we were able to identify that issue and promote safety measures to better protect that resident. We are requesting 17 FTEs, most of whom will be advocates in the field, along with other staff needed to support them. Funding OOLTC is an important piece of the puzzle in funding long-term care because we provide unique resident-directed services that promote resident rights and safety. And Senator Hoffman, you mentioned earlier that the funding from this committee has a significant impact on real people, and that's what funding to our program does. Thank you for your time today.
Thank you, Ms. Almquist. Mr. Drucker, Director, Office of Addiction and Recovery. See, your title's a little shorter than hers.
Thank you, Mr. Chair and committee members. As you said, my name is Jeremy Drucker, and I serve as the Addiction and Recovery Director for the WALS administration. I know brevity is the soul of wit, and so I will make my remarks short so we can keep the committee on track. But I just wanted to thank you for including the governor's proposal for a permanent Office of Addiction and Recovery in your budget, but also in the investments in the SUD space. I know you know how important that is, and I appreciate that. The overdose and substance use crisis nationwide and in Minnesota is continuing unabated. Drug overdoses have increased exponentially over the last several years, and drugs on the street today are more dangerous than they've ever been. Last year, the legislature and governor created a subcabinet on opioid substance use and addiction, as well as a governor's advisory council of the same name. The subcabinet is working across state government to align efforts and break down barriers to substance use disorder services and recovery. That legislation also called for the Addiction and Recovery Director to bring forth a recommendation for a permanent Office of Addiction and Recovery, which is what's included in this budget. So thank you again. This dedicated funding creates a sustainable platform for coordination, innovation, data sharing, and public engagement to improve outcomes related to opioids and other substance use disorders. I look forward to working with you moving forward as we move a package that's comprehensive response to the opioid and substance use disorder issue, and that's aimed at saving lives, increasing treatment and recovery, and protecting our communities. Thank you so much.
Thank you, Mr. Drucker. And just a couple of things. We wanted to make sure the youth, that was all integrated in there, make sure that, and the comments that Ms. Abderholden made, if there's something we can do, as we're trying to get this spotlight on what we set up last year as a committee, and actually, off of the governor's executive director, and then we embedded it in law. And I think it's really good to see you here in front of us. So thank you, you two. And then before we go, it's Sue Hankner, and then Dr. Larson and Amanda Vikstrom. You want to start working your way down. So Ms. Hankner, thank you guys. Thank you.
Chair Hoffman and members of the committee. For the record, I am Sue Hankner representing A-Team Minnesota. A-Team Minnesota is a network of families across the state who have a member who is unable or has limited ability to speak or advocate for themselves. We thank you for your efforts to reinforce supports our family members need in their daily lives, especially competitive compensation for direct support professionals. No home, work, or life enrichment disability services can be safe or feasible for them without direct support professionals. We recognize, applaud, and support your wish to do more. We thank you for listening to families who ask you to honor their informed choice for work. Center-based special wage work options are an informed choice of many family members across the state. Thank you for honoring their work option choice and not taking it away. Because of you, person-centered planning and informed choice laws ensure that each person with a disability has opportunity to gather information, examine the availability of choices, evaluate them, and to determine what best serves their needs and wants within their own communities. We support development of a full array of choices from which to choose. As parents, siblings, aunts, uncles, and grandparents of people with moderate to profound intellectual or developmental disability, we thank you for honoring informed choice. To us, you are all-star champions. Thank you for giving us time to share our thoughts with you today.
Thank you, Ms. Hankner. Informed choice is a federal law. I appreciate your comments. Dr. Eric Larson, and then Amanda Vikstrom. So, and then Dr. Chris Johnson, you can work your way down too. So, doctor, and we have two doctors up here pretty soon, unless you're a doctor too. So, doctor.
Thank you, Chair Hoffman and members of the committee. This is in reference to line 718. I'm Eric Larson, and I'm here with Melissa Haley, speaking on behalf of the Autism Treatment Association of Minnesota, a group of provider agencies that employ 1,000 clinicians across Minnesota. We're here to thank you so much for including SF 1765, the Emergency Grant Program for Autism Treatment. This grant program will help to restore our ability to function in the face of the great workforce resignation that we suffered over the past 2 years. As you know, the resulting loss of fee-for-service payments caused a total drop in payments by DHS to our agencies of $20 million. With these new grants, we can rebuild our efforts to aggressively recruit, train, and support workers who come from rural populations and from disadvantaged populations, as the EIDBI autism program was designed to do. This new workforce will give us a chance to restore access to treatment to the 2,600 families who had been forced back onto waiting lists for early intervention. Thank you so much for this badly needed assistance. Thank you.
Thank you, Doctor. Ms. Vikstrom.
Good morning, Chair Hoffman, committee members. My name is Amanda Vikstrom. I'm the Executive Director at the Minnesota Elder Justice Center, a statewide nonprofit working to address elder abuse, neglect, financial exploitation, of older and vulnerable adults. We provide support and advocacy and legal services to over 900 victims of elder abuse each year. Thank you for supporting older adults and vulnerable adults in this bill. The wage increases for service providers of all types who care for Minnesotans across the state are necessary and appreciated. We support the increases in funding for the Ombudsman's offices in this bill. That is critical for those clients that we serve and older adults, vulnerable adults experiencing abuse. I'm here to highlight two other critical parts of this bill. First, this bill represents the first time the Senate has proposed to use state funding to support our adult protection system in Minnesota. Phase 2 of the Vulnerable Adult Act redesign invests over $50 million for grants to counties. This funding will greatly increase the capacity of counties to serve more vulnerable adults who may be experiencing maltreatment or abuse and address the variety of inequities that exist in the system throughout the state. In order to ensure these results actually reduce the disparities the bill is seeking to address, it is important that this money is used in addition to county current spending use and does not supplant their efforts. We will be working with the department to make sure that the language reflects this crucial distinction. And finally, we want to thank you for including $4 million in one-time money for supported decision-making. Many thanks to Senator Rasmussen for his advocacy and leadership on this bill. These new supported decision-making grants will provide hundreds of Minnesotans over the next 2 years the chance to make informed choices with the support of others rather than be placed in overly restrictive guardianships. This provision did not make it into the House proposal, so we look forward to helping to ensure it makes it across the finish line in conference committee. Thank you.
Thank you, Ms. Vikstrom, for your work. And before you start, Dr. Johnson, Pang Vang and Chekio Richmond, come on, work your way down. Dr. Johnson, welcome.
Good morning, and thank you, Mr. Chairman and members of the committee, for having me here today. My name is Dr. Chris Johnson. I'm an emergency medicine physician, and I served as chair of the Department of Human Services Opioid Prescribing Work Group for 5 of its 6-year existence. And I'm here to argue for the ongoing need of the Opioid Prescription Improvement Program. And I will try to explain in 3 minutes what I struggled to do in 19 minutes in my 2018 TED Talk, which is the nature of the opioid crisis in America and the medical industry's central role in causing and maintaining it. A topic that gives me no pleasure to discuss, frankly. My experience in the emergency department is what got me interested in opioid advocacy. Back as far as 2003, I was treating patients in the emergency department who were having complications from their opioids, either actively overdosing or having exacerbations of their chronic pain despite high doses of opioids. Sometimes I could save the overdosing patients and intubate them and put them on a ventilator, and sometimes I couldn't. And that is the tragedy I saw almost every day. There is still an ongoing prescription opioid crisis. In 2021, 16,000 Americans died of prescription opioids. This is the same level as 2010, 2012, where we're discussing the prescription opioid crisis in America. The fact that fentanyl has now surpassed that doesn't mean there still isn't a prescription opioid crisis and that the OPIP is now no longer necessary. There is. In fact, 3 out of 4 users of illicit opioids begin with prescriptions. Now, it has come to my attention that you've been given a letter from pain physicians and the Minnesota Medical Association, basically to the effect that this is a DHS overreach, that OPIP is no longer necessary, and I'm going to argue that it is very much necessary. One of the arguments is that because we have state medical boards, we don't need OPIP or some oversight agency to talk about prescribing. Well, we've had medical boards in every state in the union since then, whenever, and this crisis still happened. In fact, the state medical boards took millions of pharmaceutical money and hundreds of thousands in selling this book, Responsible Opioid Prescribing, which is funded by the pharmaceutical industry. Pain physicians as well has been central in the role in expanding the use of opioids without evidence stating that they were safe and effective for chronic pain with no controlled studies. The American Medical Association and the Minnesota Medical Association are also conflicted in this, and they also have pharmaceutical company relationships. This is the Board of Trustees meeting in 2019 from the AMA. I actually served on the board of trustees of the Minnesota Medical Association from 2015 to 2018 and on their opioid task force from 2012 to 2014. I can tell you they did almost nothing. They emphasized selling addiction services, which is fine, but they did nothing to address the conflict of interest which caused the expansion of prescribing in the first place. The opioid prescribing work group is comprised of independently experts in the fields of medicine and have no such conflict of interest. We develop these criteria with the greatest care, understanding that disenrolling physicians is of huge consequence to their careers and only done in the most egregious circumstances when patients are actively in harm's way.
Thank you, Dr. Johnson.
Mr. Chair.
Ms. Vang. Yeah.
Are we allowed to ask testifiers questions?
You know what? I think, it's your committee, and you know what? We'll do whatever you'd like to do on this, because members have absolutely. So if you want to ask a question on somebody, go for it.
Thank you.
Control
Okay.
Mike. Mr. Johnson, if you'd allow, Mr. Johnson, if you come through the chair, I would like that. Senator Mayquade.
Thank you, Mr. Chair. Dr. Johnson, I did receive that letter, and so I had just flipped to the section in the bill that dealt with it, and I'm not sure if what I read in the letter is particularly what I'm seeing here, but I did have a question. The way that sanction standards are written is it's just to providers enrolled in medical assistance or Minnesota Care. Is that accurate? Am I accurately describing the bill, Mr. Chair? Is that accurate?
Dr. Johnson, I think you want to, this is a follow-up probably with some folks that we have at the department, but if Dr. Johnson knows the answer to that, to the question that Senator Mayquade has, if you know the answer to that, that would be appreciative. Dr. Johnson.
I believe this is those enrolled in public programs, medical, yes.
Thank you, Mr. Chair. And so I think what I was reading here brought up a concern that I wasn't articulated in the letter at all. Is would this deter providers from taking patients who are enrolled in Minnesota Care Medical Assistance?
Yeah,
Just the way that this
Yeah,
is laid out.
Senator McQuaid, you're getting the same, and I think other members of this committee too. It's like there was there's a disconnect between, the ORAC folks that are experts that we've placed as legislators, right? And it's the other body, right? So I'm getting comments from the other body that is bipartisan, right?
Mm-hmm.
So it's bicameral and bipartisan about some concerns addressing what you just brought up. And so I think before Monday, we should probably figure out what we're going to do, because, we're going to have about, 3-4 weeks here to figure it out. And if it's looking at that section, if they didn't get it right, if people didn't get it right, then maybe we should help push that conversation and at least then get the conversation in conference committee and then make a decision as a committee what we want to do. And maybe between now and Monday, we can do that conversation. But you're bringing up the exact same issues, and actually even more issues that, I'll name the reps, both Republican and Democrat over there, and the minority and the majority that have been raising too, and seem to be like they don't have some closure there. So maybe our committee, we can get closure on this, or at least, lead that. So I appreciate you doing that. So Ms. Vang, Senator, we're good? All right, thank you, Dr. Johnson. You can head out. Ms. Vang, please.
Mr. Chair, members of the committee, my name is Pang Vang. I'm the treasurer of the Minnesota First Provider Alliance, a statewide membership association for personal care providers. I own a minority-owned PCA agency, Rainbow Healthcare, located in St. Paul for the past 20 years. We appreciate the work being done and the ongoing dialogue around reimbursement rate and the importance of getting it right for the most diverse program. But the PCA reimbursement rate has never kept pace with the wage increases. The Provider Alliance believes that the PCA program is at risk of collapsing without a significant investment. This is especially true for the many smaller BIPOC-owned PCA agencies. Less diversity in our pool of providers will limit the ability of recipients to receive care from members of their community. Please amend SF 2934 to increase the implementation factor to 94.75%. We believe this increase will get us the reimbursement we need to support the wages in the CBA. This continued investment is essential to support the efforts of providers and the 44,000 individuals receiving services to recruit and retain workers, allowing them to continue to live in their own homes and out of more costly settings. We believe One Minnesota should include the disability and seniors. the most vulnerable people in our state, but sadly, they're being left out. Lastly, in this bill, there's a new HCBS Workforce Incentive Fund grant program. As it is defined, PCA is outside of scope of this grant. These incentive payments are similar to those that are contracted for in the SEIU agreement. Minnesota First Provider Alliance believes traditional PCPO agencies should be eligible for these grants as well. Traditional workers are no less important and should be rewarded for all their hard work, along with choice and DSP workers. Thank you for allowing me to testify today.
Thank you, Ms. Vang. And before we go to Ms. Richmond there, Ali Imaya and Alisa Dot, you want to work your way down, that would be great. So Shaquille Richmond, did I get that right?
It's Shakaya.
All right, that's it.
That is okay. Good morning, Mr. Chair and committee members.
Thank you for briefing me some grace on that, and welcome back. Welcome back to our committee.
Thank you for having me back. For those who don't know, my name is Shakaya Richmond. I'm a board member of RPA in Minnesota. I'm also an owner and operator of Healing Homes Living Services, an assisted living facility right here in St. Paul, where I service those that are on CADI and BI waivers. I'm here to testify in support of the proposed provisions in the Omnibus bill that will increase the payment rates for CADI and BI. Not only am I aware, and not only is the association aware of the crisis in long-term care, but we're also experiencing it on a daily basis. As an operator and owner, I find myself working 50-plus hours a week to ensure that my facility is properly staffed and that my residents are receiving proper care. This increase will directly impact not only my ability to staff, but other small BIPOC providers as well, and it will also directly impact our ability to pay our employees a livable wage. I'd like to thank the committee for not only recognizing the seriousness of this crisis, but also taking action by investing in the increase for the BI and CADI waivers. Thank you.
Thank you, Ms. Richmond. Mr. Imaya, welcome.
Thank you. Thank you. To the chair and committee members, my name is Eli Amaya, and I'm a member of the Residential Providers Association of Minnesota, along with Ms. Richmond. My wife and I operate 2 assisted living facilities, one in Brooklyn Park and one in Brooklyn Center. We have 14 employees, some of whom are part-time and some of whom are full-time. I have to tell you, over the last 2 to 3 years of operating those 2 assisted living facilities, it's been extremely difficult for the staff members that we have, for the team that we have working with us. It's been extremely difficult because of the many illnesses that many of the clients we serve have faced. For example, during the COVID pandemic, some of our clients got COVID. Now imagine yourself calling a staff member and saying, hey, I need you to come in, but before you come in, I just have to let you know this client has COVID. And those staff members still came in. They still came in. Had they not come in, those 2 businesses would not exist right now. So what you have done here, Chair Hoffman and the committee, you have enabled us to be able to pay these people the wages that they deserve for all that work they put in. Because had they not done that, these people would not have the care that they needed, they deserve. And these 2 businesses in Hennepin County would not exist right now. So what my wife and I used to, one of the skills we have is people skills. You know, when people feel appreciated, they're more willing to work for you. When you thank people for the work they do, they come in. But these people skills, and you all have people skills, you're elected officials. These people skills that we have will not be able to pay rent, will not be able to pay any mortgages, will not be able to put any food on the table. With this bill going through, we'll be able to have a little more funding to be able to give our employees a raise so that they can pay rent, pay mortgages, and put food on the table. Additionally, we'll be able to support more, we'll be able to have more services and more quality, higher quality services for the clients that we serve. So today, I thank you, my staff thanks you, and the clients that we serve thank you. I understand that this is obviously a divided government and it's not a dictatorship, so you will have to hash out some things with the House as well. My only request is that when you do that, please, please, please stand strong for us because we absolutely need this funding to go through. The clients we serve who are the most vulnerable in our communities absolutely need for this funding to go through so that they can have enjoy that high quality of life. I just want to say, in conclusion, thank you very much.
Thank you, Mr. Maya, for driving here all the way from wonderful Brooklyn Park. So I'm kidding. That's supposed to be funny, so that's okay, because I'm in Champlin. Forget it. My wife was right. I'm not funny. Don't try to be funny. So, Alyssa, thank you, too. And then Alyssa Dott, welcome. And then Michelle Sancartier, Will Lyken, and Cameo Zander, you guys are the next contestants in front of our committee. So go ahead. Alyssa Dott, welcome.
Chair and members of the committee, for the record, my name is Alyssa Dott, and I'm the Senior Director of Host Homes, Care Coordination, and Deaf and Hard of Hearing Services at Lutheran Social Service of Minnesota. On behalf of LSS, thank you for the long-term investments in Senate File 2934 that will improve access to service, build community connection, and remove barriers to health and well-being for our neighbors. LSS has provided written testimony noting several provisions that we are thankful for, and I would like to uplift one: the development of life sharing and consultation with providers, people with disabilities, advocacy organizations, and lead agencies. Since 2011, LSS has been providing life sharing services, or host homes, as we like to call it at LSS. This is a relationship-based living arrangement that carefully matches a person with a disability with an individual or family who opens their home and shares their experience and with the person that they support. Life sharing is a proven model, and research shows that by living with a family, a person with disabilities has the opportunity to participate in all desired aspects of family and community life. In comparison to other service settings, people who live in host homes have more outcomes present in the following areas. People have the best possible health, people experience continuity and security, people participate, interact, and are integrated into their community, and finally, people realize their goals. Developing this service in collaboration with partners will allow us to build our partnership with DHS and co-create a service together that more closely aligns with the widely recognized life-sharing service. Thank you, Senator Hoffman and committee members, for your support of this provision. We are hopeful that it will increase awareness, accessibility, and viability of person-centered and culturally responsive supports for Minnesotans with disabilities.
Thank you, Ms. Stott, for your service, too, and thank you for those comments. Ms. Sancartier, Director of Public Policy of Minnesota Social Services Association, and Will Lyken, you're here for the Minnesota Association of Sober Homes. So, Ms. Sancartier.
Thank you, Chair Hoffman, members of the committee, for the opportunity to share our comments. For the record, my name is Michelle Sancartier. I'm the Director of Public Policy and Advocacy with Minnesota Social Service Association. We're grateful for many things that are included in this bill, and we're incredibly grateful for your hard work in creating it, which we've outlined some of the specific things that we're grateful for in our submitted letter. I do want to get straight to the point. So we were disappointed to see that funding for human services provider safety was not included in this bill, and we urge you to consider adding that, as outlined in Senate File 1489, in your final omnibus bill. This would help address burnout and the workforce shortage by providing resources to ensure employee safety in human services. There's a lot of support for these provisions. We've heard it loud and clear from our 4,000 members across the state. This is a serious problem in human services, and it needs to be addressed now. We also have the support of 45 health and human services organizations, large, small, statewide, public and private, and many of those you're familiar with who've signed on to this issue as well. Additionally, while the omnibus bill in Senator Wickland's committee includes dollars for healthcare safety, I do want to draw your attention again to the fact that there aren't grant dollars for human services safety that have been included in either omnibus bill. This unfortunately does send a message to human services providers that while we value the safety of those in other industries like healthcare, their safety in a field where safety incidents are ubiquitous is not as valued. Safety incidents are normalized in human services. There's a critical shortage of human services providers, and workers are not going to tolerate conditions where their safety is in jeopardy. Safety is a basic human right. This is a growing problem. It's critical that we take this seriously right now, and want to urge you to consider this as you figure out what it's going to take to build the human services workforce that we desperately need. We urge you to let providers know that we value their safety. So thank you again for the opportunity to share comments on this bill and the work that you're doing, the great work that you're doing to improve human services in Minnesota.
Thank you. Mr. Lyken, welcome to the committee.
Good afternoon, and thank you for your time. My name is William Lyken, and I'm the Executive Director of the Minnesota Association of Sober Homes, also known as MASH. We are a nonprofit dedicated to certifying, inspecting, training, and supporting sober housing across our state. First and foremost, we would like to thank the Senate, this committee, and especially Senator Abler, Senator Rasmussen, and Chairman Hoffman. Thank you for listening to our concerns over dangerously rushed sober home regulations. The Delete Everything Amendment is superior legislation that clearly defines what a sober home is. However, we must remain vigilant. Additionally, we would like to state our concerns for the record. In the context of this bill, it's worth reminding ourselves that we all share a common goal: to increase access to quality sober housing no matter one's ethnicity, religion, or proximity to the Twin Cities. Furthermore, we all want to eliminate or rehabilitate the few bad actors within the field. However, I can firmly say that this section of the bill, still in the House, is counterproductive to our common goals. Within this bill, we are deeply concerned by staffing requirements to conduct assessments and handle medications that would impose costs on sober homes, either forcing them to close or price out residents, creating an inferior certification system at a far higher cost, the mandated lengthy eviction process that would allow for an individual using alcohol or drugs to remain in a sober home for potentially weeks, thus threatening the health and safety of all residents in the home. Furthermore, background checks for staff that may disqualify valuable individuals who may have passed charges such as possession or DWIs, restricting resident choice by mandating certain recovery pathways out of existence, and lastly, an overly punitive private right of action that threatens the viability of homes. Put simply, this bill seeks to eliminate bad actors by clumsily eliminating a broad portion of the sober home ecosystem. Eliminating sober home beds will lead to more homeless individuals and more overdose deaths. People need a safe and stable environment within which to work on their recovery. Reducing access and increasing prices will not help the vulnerable in our society. Despite all this, we do see a lot of common ground for future legislation and collaboration. We'd also like to note that in 2022, the legislature commissioned a study group to assess sober housing. The final report was due on September 1st of last year, and as of this date, no stakeholder group has seen the findings of this study. Today, the legislator is being asked to consider legislation on an issue without the information that it commissioned. As a nonprofit worker, it is very encouraging to see that this committee listens to community partners. In this time of historic overdose rates, we have to pay attention to how we handle this. There's plenty of room for collaborative, proactive legislation based off national best practices. We ask that MASH be given the opportunity to collaborate with stakeholders and the state to provide the superior legislation that our residents deserve. Thank you very much.
Thank you. Cameo Zender, you're next.
Good morning, Mr. Chair and members of the committee. My name is Cameo Zender, and I am with Pediatric Home Service. We provide complex home care to medically fragile children, including two critical services that are recognized in this bill: enteral nutrition and home care nursing. Thank you for protecting this most vulnerable population by first ensuring that children have access to specialty enteral nutrition products with a rate methodology that was developed in cooperation with the provider community and the Department of Human Services. As well, we are immensely grateful for the meaningful increase to home care nursing. This bill shows that you value the approximately 1,000 children who rely on home nursing to live outside the walls of a hospital, to be home with their families, and to access their rights to integrate into their communities and to attend school. This bill shows that you heard the plea from families that are desperate for additional nursing care, many receiving only 35 to 50% of the hours that are prescribed by their child's physician. This bill also shows that you acknowledge the facts that were shared by physicians and discharge planners of children remaining in the hospital for months, just waiting for nursing, costing the state millions of unnecessary dollars. Finally, this bill shows that you recognize the remarkable skill of ICU-level nurses that are choosing to practice in the home. The rate increase gives providers the ability, like PHS, to close the gap in this pay disparity so that nurses aren't asked to sacrifice pay that is 50% higher simply because they're choosing to practice that same skill in the hospital. This bill gives us a real opportunity to better recruit and retain home care nurses with the pay that they so readily deserve, so that children can be in their homes and with their families, and all of this while reducing the total cost of care by decreasing the spend in hospitalization. On behalf of Tiffany and Carter and Anna and Gilbert and hundreds of additional families, we say thank you. We say thank you for listening and more so for taking this critical action. We know there is work ahead and we are committed. We will keep beating the drum until every possible decision maker hears the music. Thank you so very much.
Thank you, Ms. Sander. 2 minutes and 25 seconds. I appreciate that. That was, I wish Matt Freeman was still here so I could shoot another one across the bow. I'm glad we're laughing. This is serious business we're about, committee, and I appreciate everybody's input in this. And as we look at Monday, we'll meet at 3 p.m., mark up amendments. If we missed something, and look, what we did is early on, we had the conversation in Senate File 7, which was a collaboration of everything we've done, and there's more stuff in here. If there's something missing, I thought we had captured pretty much as we could to get a good Senate position. Comments from members at all as far as go? Senator Mitchell.
Yes, thank you, Mr. Chair. Are the testifiers that were here today still going to be available when we reconvene? Should we have more questions?
On Monday, or
Yes.
if you have some questions now that you want for somebody, you absolutely, we have a little bit of time here, but if you have a question you want to do now, you can either do it now since you have, carpe diem or whatever it is, vini vixi vit, I don't know the Latin phrase, but when you capture the moment.
Veni vidi vici?
Something, how do you say capture the moment in Latin? Somebody call Dr. Ann Rash, she was a professor of Latin. Huh? Sir, what is it? I did get it right the first time. Thank you. Seize the day, seize the moment. So if you want to seize the moment, Dr. Senator Mitchell, you sure can.
So I had a question, and I missed some of it because I stepped out, but about the budget reserve thing, because I've never seen language like that before. So I don't know if it's for council or if it would be for the budget office, if they're here, about just how that would work.
So, yeah, if you want to, you're talking about in the first in the title piece of it, that's just pretty standard for anything that's been out of this committee. If there's specifics, if you'd want, we can get, if Mr. Raymond, if you want to talk to Mr. Raymond as you go, that's more than, I guess more than 5 minutes worth of conversation. Or specifically, Mr. Raymond, is there something you would want to help Senator Mitchell understand regarding our statement of budget reserve?
Sure. Yes, Mr. Chair. So I noted during my original remarks just that so there's a provision that amends, it's Chapter 16A, which governs how the forecast is constructed. So what's included in the bill is a provision that would move funding for the long-term care access fund to just before the budget reserve when there was a positive unrestricted budgetary general fund balance at the close of the biennium. So there's language included in the bill on determining what the contribution amount is. And MMB would be the one to determine this, and it would be subtracting the projected long-term care MA spending in the essentially the November forecast from the most recently enacted general fund appropriation. And so this would only apply to balances that are greater than zero in that calculation. And then that amount would be, if there is essentially a surplus in the November forecast, that would be the contribution amount that would be included in the long-term care access, or that contribution amount would be funded if there was a budget surplus, essentially. And it would be, in statute, there's an order of priority in terms of what gets funded first. And currently, I think it's cash reserves, and then it's the budget reserve account. And this, the way, as the bill's constructed, it would put the this long-term care access fund piece kind of just above the budget reserve.
Thank you.
And we're saying that's standard for, so would that be what would have otherwise been a future surplus? And we're saying that it's normal for any future surplus to go into the human services budget?
So I can answer that one. Thank you. And Senator Abel to that point, but you remember the comments that we were making about there's $1.825 billion, right?
Yes.
So we're not spending money if it's underspent. Remember when Ms. Bailey did the presentation early on, there was 1.125, and I might be off by 0.125 or something. But all I know is I had in my mind, if you add the FMAP, the Federal Medical Assistance piece to it, we had 1.825 billion that's sitting in that surplus. And I said, how do we capture? So in a sense, what we're doing is before it goes, its intention was budgeted and to be spent on human services, right? And so if we don't spend it, I'll give you an example. Dr. Larson was up here, and Senator Abler knows this number. There's like about 1,400 kiddos because of fee-for-service that were to receive autism services, right? It was budgeted and placed on the table to be used for that, but because they couldn't do the fee-for-service, which is the face-to-face, that money wasn't spent. So because that money wasn't spent, it ended up going to the general fund. Instead of, we want to have it come back through the system somehow and help support our Department of Human Services. Does that help?
It does. Is this something that is this how we normally do? Someone's shaking their head, no, this isn't how we normally do this.
This is not normal. This is brand new. This is brand new. This is something that we look at just how important it is on the side of that. And so this has been conversations that have been outgoing and underwent for a long time. And I jokingly, not jokingly, but I was serious. And Senator Mayquade, when we would say there's, how much money is sitting in the surplus that should have been spent, that was where that all comes down from, should have been spent. So we want to capture that.
Am I allowed to ask the budget office how this would work?
Absolutely. MMB is actually going to get involved. This is going to be a deep discussion on Monday, but.
Oh, okay. Well, that's why I was asking. Are we asking these things now, or are we asking them?
Yep.
I mean,
before
it's Friday, I understand.
No, you're good. But before that, Senator Abler, to that point real quick, and then Mayquade after you. He's in downtown, he's at his doctor's office.
Thank you, Mr. Chair. Yeah, is that coming through? I'm on my phone here, but I've enjoyed the discussion. I heard probably 2/3 of the testifiers. And Mr. Chair, just to summarize, and I'll get to the point too, but I think we really do have the best human services omnibus in a long time, or maybe it's.
You're cutting out, Senator Abler. I
services we're providing and the families and all that. And if we're on defense on some things, Mr. Chair, this is actually going on the offense to try to capture what's ours, and just merely because, so we fight for this budget. This budget we got in front of us is balanced to a target. And then when it underspends, there's things we would have done otherwise that would have got spent that we didn't get to know we were going to buy because of the unknown underspending. And that goes back into the general fund bucket to buy a bunch of worthy things. But the people that we were trying to help were deprived. And so that's the challenge, and I appreciate the effort. But Mr. Chair, I think the committee should feel really good about where we're landing to start off with negotiations. I think it's clear that the Senate position is we care about the people with disabilities, we care about seniors, we care about people who are frail, and that we're going to stick by that really hard through the process. So thanks, Mr. Chair. Thanks for the moment.
Thank you, Senator. Senator Mayquade to the discussion.
Yes, thank you, Mr. Chair. I think the one question I had is there is, like, what the long-term care access fund will fund, what programs, and how do we have ongoing programming from varying funds?
Yeah, and the purpose, thank you. And the purpose of that, and I'm glad we're having this conversation, but let's give for an example. And you're with the department, correct?
Yes.
So before I get to you, I just want to get to a couple of viewpoints. Right now, you want to open up a 245D program, name it. And statute says 60 days, right? But because of the fact that DHS doesn't have capacity to push all the paperwork, I mean, they're doing the amount of work that they're doing in the same amount of FTEs. Not that we want to give them 1 million FTEs, Senator Utke. I keep you in the back of my mind. But in this case, if there's something in the system that's stopping you from getting to the consistency of where you need to be with current state statute, right? What do we need to enhance them? Well, anytime that they want to get somebody to do the work, they got to come to us for permission, right? Or if there's a need, emergency need or something, or they're needing to spend, there's a whole series of stuff that we can help define that are important that we can control, right, in this bucket of interest, which is human services. And in that case, that would help alleviate, I think, a lot of concerns we have within the system. And it's to me, to balance, and this has been a problem for years, to balance your budget on the backs of people with disabilities and on those folks that are most frail and those elderly in our society, that we've said this money's in need, it makes zero sense to me. It absolutely makes zero sense to me. It makes almost as much sense as having a waiting list for services. I don't know, what happened to that? 1999, 2000, 2001, they got rid of the waiting list, and all of a sudden it started coming up where counties were not spending the money and people were being denied services, so there was a lawsuit that ended up going. Why should we have this stuff in lawsuit stuff? And so my point for us here, and you'll see another one, there'll be another amendment coming as well that addresses that on Monday. It'll be a deeper conversation. But why is it that we all of a sudden, if we don't spend the money, the department needs that money to do the services that we all expect people to do, it goes to the general fund, and then it goes, and I'm not going to make the comment that I made a couple years ago when I was talking about this, because a friend of mine actually he does gravel roads in McLeod County, and I made a comment about it goes to pay for gravel roads in McLeod County, and he called me up and he said, what are you trying to do, keep us from doing our gravel roads? So I'm not going to make that comment, but rather it is essential that we leverage as much as we can in order to help maintain the services and even enhance those services too. That's the whole conversation on this, Senator Mitchell. Hope that makes sense. And you want to go to the department and get into another deeper conversation, or are you good until Monday?
So I'm just trying to understand, so I just did the veterans bill yesterday, right?
Yeah.
And I had a target that I had to work in. If I had extra money and I could have grabbed money from the future fund, I had more homeless veterans projects I could have funded. So I guess my question is, if we add a clause to kind of grab general fund money,
No, that's not my
am I misunderstanding?
Yeah,
So that's
you
why
are.
I'm asking.
That's
if
okay.
Maybe the budget.
Maybe you and I will
people-
talk offline
Okay.
so I can help explain it to it. I don't know if the department wants to help explain. Do you know what the intent is, what I'm trying to do? Because if you come with not understanding the intent that we want to do, which our committee has complained about all along, is why is money that should have gone, right? This is, and maybe I'm not saying it, money that we know that we budgeted that should have gone for X, which are services to people in this DHS bucket. And because it's not spent, that's called an underspending, right? And the underspent money, instead of staying in the bucket of the Department of Human Services, that underspent money, Senator Mitchell, goes into the general fund, and then it's up for grabs. I'm not saying grab something that doesn't belong. I'm saying grab it because it belonged here. So if I'm not clear on that, then I'll clarify it. If you can help clarify that, or if you have an understanding of what her question is, go for it.
Thank you, Mr. Chair, and for the record, I'm Josh Reason. I'm a Senior Executive Budget Officer at Minnesota Management and Budget, and I think one of the questions that Senator Mitchell asked was sort of, what does this language require? So on lines 1.5 to 3.22, sort of it requires during the forecasted program, MMB, to calculate the difference between, if there's underspending, between what was the enacted appropriations versus what was in the forecast, report that, and then if there's an unrestricted positive balance in the general fund, transfer that money at the end of the biennium. I think my agency has a little bit of concerns with this language and the impact that it has on maintaining the budget reserve at adequate levels, because what this language would do is take language that would take funds that would otherwise, at the end of the biennium, be on the bottom line of the general fund and transfer it to a restricted use fund. So this would have the impact of changing the forecasted program and reducing available general fund resources. And I think we have concerns from that perspective, because it would constrain the impact of future legislatures to make policy choices. I think we also have some concerns that this.
You know what? I'm going to stop you right there. I asked you to explain to her. If you want to give me your concerns, because there's tons of concerns, and I have a whole bunch in that as well. But the intent of that, if we're going to have this conversation, then let's do it on Monday when we mark this bill up. Because if you have concerns, then you and I need to have a conversation about those concerns. I've already had folks from MMB, and this is what we wanted to do. We as a committee are concerned about the services, and why is it that I'm sitting there fighting, now that you've brought up a concern, why is it okay when we pass a bill here, and this is not me and you, right? This is just a statement. We passed a bill out of here and amended onto a certain bill, $170 million, because the department said it's going to cost $170 million in order to implement this program that another department wanted to implement. And what we say is the state of Minnesota pays those salaries to the individual vendors, who then pay those salaries to the individual person, but it's the state who drives that piece. And now the state's going to drive something else. So I'm going to give you $200 million in reimbursements, but I'm going to pull $170 million back to pay for this system. And it made zero sense to me that provision was strucken out in a finance committee hearing, right? And so when we're sitting there saying we're trying to fight for everything we can in order to make sure services are intact, this is just one more conversation. So I'm glad you asked the question, because it's not just a simple conversation, and I can already see.
I just saw this today.
Oh, I knew there was going to be people coming out of the woodwork, just kind of like we're going into the deep details on stuff, and some people would call, but it's called a forecast grab, and it absolutely makes sense for this bucket of stuff, and it's worth the conversation. So I appreciate you bringing it up, because you can see the passion, and it's not just me, but there are other members on this committee that have also had concerns about money that should have gone to people with disabilities and elderly ends up going to over here into the surplus, and it's like, now it's open for anybody? That makes no sense to me. It still doesn't make any sense to me. It's kind of like, I'll tell you one that never made any sense to me. Years ago, there was this piece where the state of Minnesota decided to balance their budget, right, on the backs of school children in the state of Minnesota. And they said, oh, we're shifting the responsibility. We're going to pay the districts back their money, but it's not going to be right away. So what happened was, because of that school shift to the tune of $2.6 billion, some districts had to borrow money just to pay their payroll, right? When indeed they've already paid taxes to the state of Minnesota, that tax money that should have gone on a per pupil unit, in this case, that money should come back to the school district, and it didn't. So districts had to borrow money, and there were some districts that ended up doing statutory operating debt, others that had to pay interest on money that should have been available, right? It's done all the time, and people say, oh, we do it all the time, but it's wrong, right? I mean, it's absolutely wrong if you do it. In this case, it's done all the time, where if you don't spend the money that we promised would go to the Department of Human Services, then it goes to the general fund. Well, we do it all the time. And to me, I'm saying it's wrong. It's just like saying it's wrong on school shifting. It's wrong. And so I'm glad you brought it up, because now we can all spend the weekend getting in the weeds. And I know, and Josh, I'm not going to need you to get into the weeds anymore on this, because I'm done with this conversation, because we're coming up on 1 o'clock. But you guys realize when we started off this year, I made the comment about how much money was in the bucket of surplus that should have been spent, right? This is now that culmination of should have been spent, so it's worth the conversation. So I hope people can, appreciate that, and let's have the conversation. So are you?
I'm still confused, but we're fine.
We're good. We'll sit. We're all confused. Talk about, yeah, no, you're fine. We're good on that. Senator Etke, to the points on the table.
Yeah, thank you, Mr. Chair. And you can add my name to the list of, as I read this last night, of being concerned with the process. And, I have heard about this unspent money throughout the whole session. But on one hand, something that just, as we're having a conversation today, is we know how much COVID money came into the state.
Yeah.
Did COVID dollars actually cover some of that? And that's something that maybe somebody can let us know over the next days. So I'm wondering if those services were probably already, they were fully funded. It's just because of all those dollars being shifted, of course, you ended up with the $1.8 billion that shows as surplus. as extra money. Be kind of, just for curiosity, to know what really caused that. And I mean, we all know the vast amount of billions of dollars that flowed into our state that helped cover a lot of expenses. So I'm kind of thinking maybe there's a little crossover there. But the language as it was written, and I was going through all the different statutes last night, and I could see what you were trying to do, but I had a lot of concerns, and I'll just leave it at that for right now. I'm going to flip ahead one step because it looks like we're winding up where we're at here today. What is the future of our bill here? When it is finally done, does it get merged with the health bill and become one, or is this travel on its own all the way through to a finish?
So what I know to that, and thank you, Senator Archie, but Senator Mitchell, did I leave you off the list of some other things? You're good. You're good? All right. So it is my understanding that we are human services, that we are matched up with the other body, which is Mahmoud Noor and Peter Fisher, and that we are staying as human services, and that the health and human services side of it, which lines up with the other body on Pinto and the other state rep from Rochester, that they're staying that way. So it is not, unless you're hearing something I'm not, it's always been my understanding that they're going to be separate.
Okay. Yeah, no, I hadn't heard anything, and I just was wondering if there was anything there to share, or if we had a plan at this point, and at this point, we're still going by ourselves. Okay.
I hope it stays that way.
Okay. Thank you, Mr. Chair.
Senator Etke moves that we stay by ourselves. Is there anything we can take a formal action on that? Because Senator McQuay or Senator Mitchell? No? Fate, maybe we should line ourselves up with higher ed or something. So, any other comments, questions? Thank you guys for opening up a door. I like it when it gets good conversation. Thank you very much for getting us to this point, you guys, and thank you everybody for having patience with us. And I like the comment about defense. You know, Louisa May Alcott said, "A faithful friend is a strong defense," and then further said, you know, finding that is indeed finding a treasure. So let's keep that momentum going here, and I appreciate the Senate position so far. We'll see you guys Monday. Thank you. We are adjourned.